Yeah. Okay. Okay. I will begin the brief introductions about the session 2. So, welcome all audience and all our honorable speakers to the session 2, lessons learned, lessons of COVID-19 and the Southeast Asia in session 2 that start from 2 p.m. until 5 p.m. So I would like to briefly introduce myself. My name is Ratchathani Pecharat, Faculty of Political Science, Ubon Ratchathani University. We'll carry on as the moderators during the panel 2. So before you begin, you can access to our QR code to give us a comments about the conference to make an improvement in the future. So first of all, I would like to introduce the second sessions that the worldwide pandemics, or why this conference has been uphill. So the worldwide epidemic situations under coronavirus or COVID-19, it has affected the people in terms of health, societies, as well as economy. To prevent this control of epidemics widespreading, many countries have taken state measures to solve virus spreading problems through area lockdowns. The policy has drawbacks on a specific times for leaving the residents of business operations enforcement, including international border controls, although these measures are aimed to preventing the spread of the disease, but the concentrations and guidelines seem to affect restrictions of rights and freedoms in the life of the peoples. So it became an issue and controversy under the human rights, not just only participations, but also the right of non-discrimination, such as dismissal without any compensations or business obstructions enforcement. So here we are, the regional human rights studies and centers at Ubon Ratchathani Universities associated with Asia Center, along with partners, seeing the importance of facing the challenge of managing epidemic crisis in Southeast Asia that against human rights issues. So now it's the first time that we gathering up a voice of people from Southeast Asian nations to speak out what we are facing on. So first of all, I would like to introduce again to all of the speakers from our Southeast Asian nations. So we begin with the voice of Thailand's Assistant Professors, Dr. Arunee Santhitiwanich, Faculty of Political Science, Ubon Ratchathani University, followed by another voice of Thailand, but from the deep south of Thailand, it's the voice of Thailand deep south, Abdulsuko Dina, a columnist at Matichon Weekly and Vice President of Civil Societies Councils of the Southernmost, Thailand, who give the representative of the voice of Thailand, followed by the voice of Singapore, Dr. James Gomez, Regional Directors, Asia Centers, and the next voice is the voice of Indonesia, Dr. Suyani Indriastuti, Faculties of Social and Political Science, University of Jember. And the voice of Malaysia, Dr. Benjamin Y.S. Law, Senior Lecturer, Schools of Media and Communications, Taylor University, Malaysia. And our last voice from Southeast Asia, the voice of the Philippines, John Phillip Binondo, Assistant of Professors, Lecturer, the LSU, Manila International Studies Department. So now we will begin with representative from Thailand. After the representative of Thailand have ended the presentations, we have some questions you can ask us. Thank you. So now we begin with Dr. Arunee Santhitiwanich to present her thoughts about the lesson and learns. So before
I think our colleague has been cut off.
Oh,
please,
right.
Please go ahead.
Carry on. So, and the last one is how to reduce COVID-19 infodemic. So this is the big questions for our speakers to have to answer as well in the presentations as well. So if you have any kind of questions, please ask us. So we will provide the time for Q&A at the end of the sessions. So is Dr. Arunee cut off from our hello? Is
She's
Dr.
here.
Arunee there?
She's
She's
here.
here.
Okay. Now we begin with Dr. Arunee about the voice of Thailand. Please carry on. Thank you, Dr. Arunee.
Thank you very much. Okay, let me share you my PowerPoint. It's must have. Okay. Good evening, everybody. Welcome to the Voice of Thailand. Today, I made to say that this is the first time for me to talking about COVID-19 in the international event, and I will show you something that everybody may know, but I have to dig down to how COVID-19 outbreak worsens structural inequality in Thailand. And first of all, why is okay, sorry. First of all, we will show you about let me show you what the Constitution of Thailand entitled the healthcare rights of the citizen. This is important for the citizen because it will guarantee your rights, that what the government should do for you and what your rights that you can call for your rights. First, I will show you the right to healthcare that the Constitution states in the section 47, a person shall have the right to receive public health services provided by the state. Actually, this statement is really common for the Thai people because we have the universal healthcare coverage or บัตรทอง30 บาทนะคะ this scheme is begin at 2002 by the democratic government, and this scheme is currently the accessibility to healthcare for the Thai people. So we look in the size of the government. The Constitution states that duty of the state shall ensure that the people receive the sufficient public health service universally and ensure the public has the basic knowledge in relative to health promotion and disease prevention, and blah, blah, blah. So I think the important is the second sentence that the public health service under paragraph 1 shall cover health promotion, control, and prevention of diseases, medical treatment, and rehabilitation. This statement is very important in this outbreak because it covers vaccine, it covers medical drug, it covers any prevention or any treatment for the Thai people. And this is I will show you that this constitution, how it's important for the Thai people in the last slide. Okay. Then I will show you the timeline in the reality. What happened in the reality in Thailand? This timeline showed this the government do. Your left hand side, your left hand side is show what government do in the period of we have little knowledge about COVID-19. You will see that the government decided to announce to launch emergency decree effective and establish the Center for COVID-19 Situation Administration (SOBK) or CCSC. This CCSC is centralized and pull the authority from other minister to prime minister. This has a word that's prime ministerization, that every authority about the healthcare service in the COVID-19 outbreak will pull at the PM of the Thailand, that is Jen Prayut Chan Ocha. And after I will show you that the day that this decree announced is relative with the higher cases in the last years. That 1,088, only 1,088. The scheme that and measurement that occur that government implement in the last year is very strongly an incentive lockdown. 25 business in Bangkok have been locked down. They control the travel of the citizens to other provinces. I remember that period. Overall, the Thai friends of my Thai friends still at their home. No one go to out there. The state is really lightened car, and everyone fear that we should to stay at home. In the case of less than 200 cases, but if you see the right hand side, the cases is very high, new high every day. Today I didn't check the number, but I think it's not less than 2,000 or 20,000 cases. And what the government do? What the government do when they have many knowledge about prevention of COVID-19? We have many knowledge about other countries, what they do, and how the result of the government performance in any or other measurements. We have more knowledge, but why the Thai cases still higher and higher in every single day? The difference between the last year and this year is vaccination for the Thai people, for the pressure group, for the frontline staff, public healthcare frontline staff, and other measurement that has added in this year is SME debt subvention. That means the business that affected by the lockdown measurement, lockdown measurement will have the suspension debt for 2 months, only 2 months. You see, only 2 months, but we locked down very long time. And more than debt suspension, more than vaccination, it also has Facebook ban. The people in Thailand now, we have to caution about what we will post on social media. Yes, and I want to tell other people that my friend told me that their friend has been affected with COVID. Your friend has known that some VIP had got a vaccine, Pfizer, but we can post it anyway because we fear that we will to be sued by the government. This is what happened in Thailand in the overall view. So I will let you see in details how is it get worse? Why the public healthcare system in Thailand that other country has think that it's a good system for the people. Why it has been worsened like this? First, we will show you the ratio number of the resources in the public health resources in Thailand. Your left hand side, you will see that in the Bangkok, in the triangle in the red color. The Bangkok, the ratio of population per doctor, one doctor will take care of the population 566 people. And the medical bed one medical bed is reserved for 192 people. This is it's the high ratio, but if you see the Isan, Northeast in Thailand, the average ratio show that it's more than 10,000. It's more than 10,000 people for one doctor. It's very inequality for accessible for medical resource in Thailand. Let's see the bed, medical bed. 562 people for one bed. What does it mean? In the normal, in the pre-COVID, it's okay. Everything is okay. But when the COVID outbreak, the cases will higher and higher, but the resources still like this. The picture in the left-hand side show that what happened in the reality. You will see this picture. This picture is like a temple of Thailand. This picture is the contemporary hospitality in the community. After this place is in Ubon, Ratchathani. This place is like open air building and has the medical bed, contemporary medical bed for only 20 medical bed. And this picture is very viral in Thailand because this is the first case that the people that infected the COVID die lonely in the road in Bangkok, and no one can recover the dead guy. And the lower picture, the right hand side, this picture is also like the people that die in the road. This picture is the people that when the cases is higher and higher, the medical bed or the building of the public healthcare or hospital is not enough for all the cases. This picture, you will see that the red bin, the yellow bin, this is the bin. The people to want to investigate their COVID test that free of charge. They have to waiting in this environmental for receive the free of charge public services from the Thai government in the period of COVID-19 outbreak. What happened? What happened for the Thai people? It will be not question about the inequality if everyone see this picture only, but it had another picture for the VIP people, for the rich VIP, or for the Thai star. This picture in the top right hand side, this picture is this rich guy that affect the COVID-19. He can fastly got the medical bed in the private hospital. That raise many questions for the Thai people. Why the poor can access the medical bed easily, but why the rich, why the VIP person can easy access the medical bed? That's why. So the answer from the VIP person is, because I have spent the money, I have spent a lot of money, I have money, so I buy the COVID-19 insurance, and the amount of payment that he paid is about 1 million to make sure that he can he will have the medical bed if he affected. And how to control the COVID in Thailand, how to control it. Okay, as far as we know, the vaccination is the answer. Yes, we know, but we need I think all of us, we need the best efficient vaccine. But the government, the Thai government, lately active about this prevention. The people don't trust some vaccine and don't trust the government also. You will see that the timeline, this is the ratio of vaccine per population in Thailand. The first of all, in February, late February, they start vaccination for medical staff and for life and healthcare for life staff. This is too long, like 4 months to take a medicine. To take a vaccine for the frontline staff. After that, in July, they kick off the vaccination for the ordinary people. But that is in the plan. The plan said that vulnerable people should be vaccination first. Elderly.
Pardon, Dr. Arunee. So we are the time. Sorry, could you please wrap up the last?
Okay, sure. Thank you.
Thank you. Okay. I know how you frustrated with the management. Okay. Okay, please.
Okay. Sorry.
Ask the conclusion.
Okay. The point is vaccine is the answer, and that has the call for the good vaccine for the Thai people. What the government do, they have the mixing vaccine for the Thai people, all Thai people that has no vaccine. Ajahn Gochapok may have this mixing also, yes?
Not yet. I will try next week. Okay, I will review it. Okay. Okay. By the way, what is the impact for the rights, human rights, and the freedom of expression? This is the right that has impact by the government measurement and the poor performance of government. The right to education, you see, learning online, learning at home. The picture home for the richer and the picture of home of the poor is different. And labor, he is the labor that infected COVID-19. They have not allowed to stay at the apartment, so they choose to live in water pipe. This is the child, the 2 years child, have to say it because her mother, her father stay at the hospital. And yes, you can post anything that you think. You can post anything that you challenge the government because it has a decree to not allow it. Yes, and this is the sum up. I have how many minutes I have? Oh, sorry. Oh, nothing left already, Ajahn.
Okay.
All right. So we'll pass to before we start our question sessions from the representative from Thailand. I would like to pass the next speaker, the voice of Thailand, Mr. Abdulsuko Dina, columnist at Matichon Weekly and vice president of civil society councils of the Southernmost Thailand, will carry on the second presentations about the problem that is happening in Southernmost Thailand. So please proceed. Thank you. So since we know, I would like to brief, because if you're thinking about, because in the Thailand deep south, it's very kind of very unique area. As you can see, the 3 deep souths, you can see, because it's is also close to the Malay world in the past until now. So the way of the societies and economies is really have a uniqueness more than the other region in Thailand as well. So should the governments manage, what kind of the government should implement the policy? So now Mr. Abdulsuko Dina will carry on and clarifies how it's looked like in the Thailand most deep south in 3 provinces. Please, Assalamu alaikum.
ฮัลโหลสวัสดีครับฮัลโหลสวัสดีครับได้ยินไหมครับ
ได้ยินครับ here ได้ยินครับผม
ได้ยินครับ
สลามครับได้ยินครับ ได้ยิน
yes ได้ยินไหมครับ
ได้ยินครับอาจารย์เชิญเลยครับอาจารย์เชิญเลยครับได้ยินครับ
ได้เลยโอเค
ครับครับผม
ไม่แน่ใจเหมือนกันตอนนี้ช่องไหนอยู่
อาจารย์พูดได้เลยครับตอนนี้เป็นเซสชั่นของอาจารย์แล้วครับ
ตกลงพูดได้ไหมเนี่ยหรือว่าพูดได้เลยนะโอเค
พูดเลยครับอาจารย์
ก็อัสสลามุอะลัยกุมวะเราะห์มะตุลลอฮิวะบะเราะกาตุฮ์ขอความสันติสุขจงมีแด่ทุกท่านครับ Please be upon you ก็สำหรับผมคงจะพูด3ประเด็นนะครับสั้นๆประเด็นที่1ก็คือว่าสถานการณ์โควิดในจังหวัดชายแดนภาคใต้และการรับมือของรัฐบาลและภาคประชาชนนะครับประเด็นที่2ก็คือในส่วนของว่าสิทธิมนุษยชนในจังหวัดชายแดนใต้ช่วงโควิดเป็นอย่างไรนะครับอันที่3ก็คือข้อเสนอแนะจากผมเองจากภาคประชาชนเองที่เสนอที่ประชุมมาอันที่1ก็คือในเรื่องของสถานการณ์โควิดในจังหวัดชายแดนภาคใต้นั้นถ้าเราดูกับช่วง3เดือนนี้นะครับตัวเลขหรือสถิตินั้นมันมีค่าถ้าคิดค่าเฉลี่ยไม่ต่างจากกรุงเทพมหานครเพราะอะไรครับเพราะจังหวัดปัตตานีเนี่ยมีคนอยู่700,000 คน700,000 คนเนี่ยเสียชีวิตเฉลี่ยอยู่ที่5 คนในขณะที่กรุงเทพมหานครคน70 ล้านคนคน7 ล้านคนเสียชีวิตอยู่เฉลี่ยก็ประมาณ50 คนต่อคนเพราะฉะนั้นสถานการณ์ใน3 จังหวัดกับภาคใต้ไม่ได้ต่างกันเมื่อไม่ได้ต่างกันรัฐบาลกับภาคประชาชนจะต้องร่วมมือกันนะครับในการที่จะหยุดยั้งหรือช่วยเหลือประชาชนนะครับซึ่งมันมีอยู่3 ข้ออันที่1ก็คือว่าจะทำยังไงให้คนที่ยังไม่ติดคือการป้องกันอันที่2ก็คือคนที่ติดแล้วจะรักษายังไงแล้วโดยเฉพาะอย่างยิ่งการที่คนมันเสียชีวิตเนี่ยนะครับเราจะทำยังไงอันที่3ก็คือมาตรการทางวัคซีนส่วนเรื่องที่1เนี่ยมาตรการที่รัฐทำอยู่ณตอนนี้ก็คือว่าการใช้มาตรการของรัฐนี่ก็คือในเรื่องของการล็อกดาวน์นะครับการโฮมโซลูชันโรงพยาบาลสนามปิดหมู่บ้านอะไรพวกนี้ซึ่งสิ่งเหล่านี้ต้องการความร่วมมือจากภาคประชาชนอย่างมากซึ่งภาคประชาชนให้ความร่วมมืออย่างดีแม้กระทั่งภาคประชาชนนี่ลุกขึ้นมาช่วยเหลือจัดการตนเองด้วยชุมชนเองแต่อันเนื่องมาจากว่ารัฐบาลในโครงสร้างของประเทศไทยณตอนนี้นะครับหลังจากคสช.เนี่ยนะครับยึดอำนาจประเทศไทยนี่มีการรวมศูนย์อำนาจมากขึ้นเป็นรัฐราชการไม่เอื้อต่อกระบวนการกระจายอำนาจเพราะฉะนั้นเนี่ยคำสั่งที่กว่าจะเรื่องโควิดได้นะครับประชาชนต้องลุกขึ้นมาก่อน แต่การที่ประชาชนลุกขึ้นมาก่อนเมื่อกี้มันจะต้องได้รับการหนุนเสริมจากรัฐซึ่งรัฐตัดสินใจช้านะครับซึ่งตรงนี้จะต้องไปแก้ครับในการทำยังไงรัฐจะต้องรีบกระจายอำนาจมากขึ้นกระจายอำนาจให้ผู้ว่าราชการมีอำนาจตัดสินใจร่วมกับชุมชนอันที่สามก็คือซึ่งผมเขียนไว้แล้วในภาษาไทยนะครับซึ่งมีมาตรการทั้งหมด19 ข้อนะครับอันที่สามก็คือการฉีดวัคซีนถ้าจะดูสถิติในจังหวัดชัยนาทได้น้อยมากอะไรคือปัจจัยก็คืออันที่หนึ่งประชาชนไม่มั่นใจกับวัคซีนที่รัฐเอามาให้อันที่สองอันเนื่องมาจากว่ามันเป็นพื้นที่ของความขัดแย้งความหวาดระแวงระหว่างรัฐประชาชนมันมีอยู่ด้วยนั้นในเรื่องของโปรปากันดามีอะไรในเรื่องของต่างเรื่องเนี่ยมันมี IO บ้างทำให้วัคซีนเนี่ยแทนที่จะประชาชนได้สามารถมั่นใจในเรื่องวัคซีนของรัฐไม่ค่อยมั่นใจในเรื่องประเด็นของฮาลาลหรือไม่ฮาลาลอะไรพวกนี้แม้ว่าช่วงหลังเองเนี่ยองค์กรศาสนาจะมายืนยันนะครับอย่างไรก็แล้วแต่นะครับช่วงหลังก็มีการรุกก็คือไปฉีดวัคซีนในชุมชนในมัสยิดนะครับในสำนักงานกรรมการอิสลามมีความร่วมมือมากขึ้นนะครับประเด็นต่อไปที่จะพูดในเรื่องของสถานการณ์เขาเรียกว่าสถานการณ์สิทธิมนุษยชนการละเมิดสิทธิมนุษยชนในจังหวัดชายแดนภาคใต้ในอดีตก่อนโควิดมาเนี่ยมันก็มีการละเมิดสิทธิมนุษยชนนี่ซึ่งมีรายงานทั้งองค์กรสิทธิมนุษยชนนานาชาติ Human Rights Watch หรือมูลนิธิประสานวัฒนธรรมที่ทำงานในพื้นที่มีการในเรื่องของการใช้กฎหมายนะครับ3 ฉบับเป็นกฎหมายพิเศษ3 ฉบับแล้วมีกฎหมายพิเศษอีกตัวหนึ่งเป็นกฎหมายควบคุมในเรื่องของโควิดนะครับแล้วก็มันมีในเรื่องของการปิดล้อมตรวจค้นมันมีในเรื่องของการตัดซิมนะครับซิมซึ่งสิ่งเหล่านี้หรือแม้กระทั่งการตรวจ DNA ครับเมื่อพอสถานการณ์โควิดนะครับสถานการณ์โควิดมานี่จนถึงวันที่2 สิงหาคมมีปฏิบัติการทางทหารจากรัฐนะครับล้อมตรวจค้นวิสามันฆาตกรรมนะครับจนมีประชาชนเสียชีวิต10 คนนะครับแล้วก็ประชาชนถูกจับกุมภายใต้กฎหมายความมั่นคงเนี่ยนะครับกฎอัยการศึกเนี่ยนะครับ85 คนดังนั้นอะไรคือข้อเสนอแนะข้อเสนอแนะข้อที่1ก็คือว่าในช่วงโควิดเนี่ยรัฐจะต้องไม่ใช้ปฏิบัติการทางทหารเขาจะถูกยังไงดีเพราะว่าข้ออะไรครับถ้าใช้กฎปฏิบัติการทางทหารนี่มันจะมีการปิดอะไรครับปิดเส้นสายโทรศัพท์เมื่อปิดโทรศัพท์ปิดหมู่บ้านปิดอะไรพวกนี้มันจะกระทบประชาชนแล้วยุคปัจจุบันเนี่ยการเรียนหนังสือเป็นการเรียนออนไลน์เมื่อเรียนออนไลน์นี่ประชาชนเด็กก็ที่กระทบอีกเพราะฉะนั้นเนี่ยผมว่ามาตรการทางทหารของรัฐเนี่ยจะต้องหยุดก่อนนะโควิดในช่วงนี้ครับในระยะยาวชัดเจนนะครับมีผลการศึกษาจากทั้งไทยทั้งในประเทศต่างประเทศนะครับบอกว่า no justice no peace no justice no peace นะครับเมื่อไม่มีความอายุติธรรมสันติภาพก็จะไม่เกิดขึ้นนะครับเพราะว่าการปฏิบัติการต่างๆมันจะเป็นเป็นเครื่องหล่อเลี้ยงอย่างดีในการทำให้ไฟใต้มันเกิดกองใหม่ขึ้นนะครับดังนั้นที่น่านำเสนอในระยะยาวคือการปฏิรูปกระบวนการยุติธรรมการปฏิรูป กระบวนการยุติธรรมกฎหมาย3 ฉบับที่เป็นกฎหมายพิเศษจะต้องไม่มีเพราะเราใช้มา17 ปีแล้วนะครับ
อาจารย์ครับขออนุญาตครับเหลือเวลาอีก3 นาทีนะครับ
ข้อที่
ครับ
2ก็คือว่าเราต้องใช้กระบวนการเขาเรียกอะไรเขาเรียกว่ากระบวนการยุติธรรมเชิงสมานฉันท์ยุติธรรมในระยะเย็นผ่าน
อาจารย์ครับเหลือเวลาอีก3 นาทีนะครับอาจารย์
transition justice TJ TJ ครับว่าอะไรครับ
เหลือเวลาอีก3 นาทีนะครับอาจารย์
ข้อที่2นะครับ
เหลือเวลาอีก3
ข้อที่2คือตอนนี้เรามีคณะกรรมการสิทธิมนุษยชนแห่งชาติดังนั้นคณะกรรมการสิทธิมนุษยชนแห่งชาติที่อยู่กรุงเทพเนี่ยต้องลงมาพื้นที่ไม่ใช่คณะกรรมการสิทธิมนุษยชนแห่งชาติณตอนนี้เป็นคณะกรรมการที่อยู่ภายใต้ทหารมีอยู่ชุดเล็กอยู่ภายใต้ทหารซึ่งการอยู่ภายใต้ทหารมันไม่เป็นกระบวนการที่โปร่งใสข้อที่3ก็คือว่าเรามีคณะกรรมาธิการยุติธรรมของสภาผู้แทนราษฎรนั่นบทบาทของคณะกรรมการสิทธิมนุษยชนนะครับของสภาผู้แทนราษฎรจะต้องทำงานถ้าไม่ทำงานประชาชนจะมีช่องที่จะก็เลยช่องทางการเมืองที่จะร้องเรียนที่จะตรวจสอบนะครับครับข้อที่สำคัญที่สุดก็คือมันมีข้อร้องเรียนทั้งเชิงประจักษ์ชัดเจนก็คือว่าการซ้อมทรมานเพราะฉะนั้นเนี่ยจะทำยังไงให้รัฐสภาเนี่ยผ่านพรบนะครับผ่านพรบในเรื่องของป้องกันและปราบปรามการซ้อมทรมาน
อาจารย์เหลือเวลาอีก1 นาทีนะครับ
และสุดท้ายสุดก็คือว่าการปฏิรูปเชิงโครงสร้างอะไรคือการปฏิรูปเชิงโครงสร้างคือตราบใดที่โครงสร้างข้างบนเนี่ยการเป็นรัฐรวมศูนย์อำนาจรวมศูนย์ภายใต้รัฐเผด็จการนี่ถ้าประชาธิปไตยไม่สมบูรณ์ที่กรุงเทพเป็นไปไม่ได้ที่จะชายแดนใต้จะมีช่องทางที่จะกระจายอำนาจที่จะแก้ไขได้แต่สันติภาพจะเกิดขึ้นยากมากนะครับครับแค่นี้แหละครับ
So ขอบคุณมากนะครับสลามนะครับสลาม So the next will be allows the questions from the people who already asked during the registrations first before we will put all the live questions into the end of the sessions. So I would like to throw the two questions that already given to Dr. Arunee and Ajahn Abdulsuko Dina. So the first question is to Dr. Arunee. So Dr. Arunee, so does the lack of internet access and the digital tools of students have an impact on educational inequalities, in particular learning standards? What is the best way learning during the pandemic? So we are now facing that internet access and some students cannot access or don't have the equipment. Another question, I would like to throw a question to Ajahn Abdulsuko. So why haven't Thai citizens got the effective COVID-19 vaccines? And what is the situation in Southern Thailand? So ทำไมประเทศไทยนะครับชาวไทยเนี่ยไม่สามารถได้รับเนี่ยวัคซีนหรือวัคซีนที่มีประสิทธิภาพเนี่ยแล้วสถานการณ์ในชายแดนใต้ในการรับวัคซีนเนี่ยเป็นยังไงครับเดี๋ยวเริ่มจาก So we'll start with Dr. Arunee first to answer the first questions. Thank you.
Okay, thank you for your questions. First of all, in the name of the lecturer in the higher education, most of students can access the internet, but even we be talking about the online learning, I think it has little condition for the higher education, but in the primary student, I think primary student or preschool student, I think online learning is not good for them because I also have a child, the little child, and the student has a very short concentrate in the some monitor, and they need other development. Is not only the knowledge but has the physical development and relation development. So it in nowadays Thailand has the proposal from other parents in the Bangkok that the government should stop semester for 1 year, stop to learning for 1 year for students. But the question, many questions has raised that how about the parents that has permanent worker? How about the white collar to take care their child? I think this question we would to have the maybe we should collaborative talking about this. I think my background is can represent other parents, and my background cannot represent the other student that has in the rural area in Thailand. Yesterday I see the picture that the primary high school student in the north of Thailand, they live in the hills. They have to work in the hill to find the Wi-Fi internet to access the learning online. I think it maybe has the alternative way to get the learning way, but I think the basic requirement is the vaccine for the teacher, the vaccine for the people, because I don't think that priority the people who has vaccine first or second by the profession. I think it's not good. I think because every single profession has to relative with the other. So I think the government should make sure that the people has full vaccination, and that vaccine has to be a good effectiveness for prevent or control the COVID-19. I think this is a basic prevention first, and method is, I think we can negotiate and we can find a way together.
So thank you for the answering the questions. I hope it's this is a very good question for you. So the next question is for คุณ Abdulsuko Dina. So ทำไมขออนุญาตเปลี่ยนภาษานะครับทำไมชาวไทยถึงไม่ได้วัคซีนที่มีประสิทธิภาพและสถานการณ์ในการรับวัคซีนที่3จังหวัดชายแดนภาคใต้เป็นยังไงครับขอบคุณครับเชิญเลยครับคุณอับดุลสุโกครับเชิญได้เลยครับ
ออนมิวครับมิวอยู่ครับต้องมิวนะครับ
ฮัลโหลได้ยินไหมครับ
ได้ยินแล้วครับได้ยินชัด
มากเลยครับชัด very clear very clear
ภาคประชาชนเนี่ยตอบชัดเจนว่าการอันเนื่องมาจากว่าประเทศไทยนี่เป็นอำนาจรวมรัฐราชการอำนาจรวมศูนย์เพราะฉะนั้นเนี่ยผมว่าตอนนี้ทำยังไงให้แก้ปัญหาก็คือว่าให้อบจเนี่ยให้อำนาจอบจเนี่ยให้ทั้งกฎหมายที่เอื้อให้ทั้งเงินให้เขาคิดกับประชาชนว่าเขาจะออกแบบเขาจะแก้ปัญหาเขาจะซื้อวัคซีนยังไงเขาจะส่งอินเทอร์เน็ตยังไงเขาจะจัดการในเรื่องการศึกษายังไงเขาจัดการในเรื่องสาธารณูปโภคยังไงนะครับตอนนี้ต้องไปคิดอย่างนั้นมันง่ายขึ้นนะครับเพราะฉะนั้นเนี่ยแม้ว่าเราไม่สามารถกระจายอำนาจในเรื่องของโครงสร้างได้แต่ว่ารัฐโดยเฉพาะอย่างยิ่งท่านวิษณุที่มีวิษณุรองวิษณุที่มีเป็นมือกฎหมายของรัฐบาลเนี่ยจะต้องไปหาช่องทางอย่างไรให้อบจนี่มี กระจายอำนาจในอบจให้ได้ณตอนนี้นะครับเพราะเมื่ออบจซื้อวัคซีนเองได้อบจในเรื่องของการศึกษาได้เพราะตอนนี้ศึกษาธิการก็ต้องไปฟังที่กรุงเทพผู้ว่าราชการจังหวัดก็ไปฟังที่กรุงเทพซึ่งมันไม่ตอบโจทย์ในเรื่องของโควิดวิกฤตโควิดที่มันไปที่เร็วมากผมเสนอก็คือว่าจะต้องกระจายอำนาจแม้ว่าจะกระจายอำนาจไม่ได้ก่อนตอนนี้ต้องหาช่องทางให้อบจเนี่ยเขามีช่องทางหายใจเรื่องการกระจายอำนาจไม่ใช่มาจับผิดเขานะครับครับ
ขอบคุณนะครับตรามากาเซะนะครับสำหรับการตอบคำถามนะครับ so we already
เพราะถ้าเรากระจายอำนาจเราจะได้วัคซีนที่ทุกคนได้วัคซีนที่มีคุณภาพได้เพราะว่าคนที่เลือกประชาชนเลือกตั้งมาเนี่ยเป็นไปไม่ได้เขาจะไม่เอาวัคซีนที่ไม่มีคุณภาพปัจจุบันนี้ก็มีปัญหาอีกในเรื่องตรวจ ATK ก็เอา ATK ที่ไม่มีคุณภาพในแพทย์ชนบทท้วงติงแล้วถ้าเอา ATK ชุดตรวจที่ไม่มีคุณภาพก็จะยิ่งเพิ่มปัญหาทำไมไม่ซื้อ ATK ที่มีคุณภาพราคาแพงก็ไม่เป็นไรนะครับครับแล้ว ATK เหล่านี้ถ้าเรากระจายอำนาจเขาเรียกอะไรนะจังหวัดต่างๆก็ซื้อได้อะไรได้จัดการได้เร็วครับ
ขอบคุณสำหรับการตอบคำถามนะตรมากาเซะนะครับ so we already have answered so those who just throw a question for us we also have the Q&A sessions after the end of every panel speaking so we move out from Thailand now so the next speaker is not from the voice of Singapore. I would like you to carry on the next share the idea and thought from Singapore. So may I invite Dr. James Gomez, Regional Director of Asia Center, to share us about the implementations of the measurements and the public policy during the COVID-19 in Singapore.
Okay, thank you, Art, very much, and thank you to everyone who's still here. I want to signpost the key developments in Singapore. So the key developments in Singapore are one on vaccination. So the debate is now about who is vaccinated and who is not, and what rights and access they have. This is simply because 76% of people in Singapore have been fully vaccinated. It doesn't say much in terms of absolute numbers because the absolute numbers of 76% is only 4.3 million. Many countries in the region far surpass that number in terms of fully vaccinated people. But what is significant here is the total population of Singapore as it stands is 5.7 million. So 4.3 million have been fully vaccinated. So I think that's the first thing, and the debate is now about who's vaccinated and who's not, and what kind of rights they have in terms of access to public areas and also activities and social activities. Second thing to keep in mind is Singapore has announced opening of borders, again in line with being fully vaccinated, unvaccinated, as well as those who are not vaccinated, right? As well as the countries from which they come, so what is the rate of infections from the country from which they're traveling to Singapore. And then finally, there are also introduction to, if you have COVID and you are diagnosed, they are also moving people into home quarantine, which means there's also an impact in terms of who can do home quarantine and also family members. Are you quarantined with family members with or without being fully vaccinated, and what is that implication? So you can see because of the volume of people, percentage of people who have been fully vaccinated, the debate and discussion of public policy and the rights between vaccinated and unvaccinated are the key debates. But with a caveat that Singapore is small and is coming from, I'll just show you this Facebook page. It's called SG COVID Idiots. It's about, telling people how to behave during the pandemic. You don't have to like this page. Actually, I'm sending you another link into the chat. That's Asia Center's YouTube channel. I prefer that you subscribe to that. It's more, I think, useful. But the second thing, and I want to refer to this idea of Ratchathani, the citizens, and the first and second speaker has made reference to it, and the guarantees that Constitution and legislation provide for public health care and citizens. That is not the debate, because the debate in Singapore goes beyond the rights of citizens. It's about rights of foreigners. Because out of 5.7 million, more than 40% are foreigners, residing, most of them in long-term passes and some short to mid-term passes. They include construction workers, domestic workers, service industry employees, financial sector professionals, students, academics and researchers, foreign spouses, and so on. Right? They come from a range of countries, bulk of it from larger Asia. The implication of this demographic profile and the debate is one that is very, very narrow in countries like, Thailand, you talk about Ratchathani, right? But the discussion of rights is not wide enough. Similarly, in Malaysia, the discussion of rights is not wide enough. It's very, very narrow. But in Singapore, the discussion is beyond. This issue comes about because the high number of foreigners residing in Singapore, they also demand the same set of social economic rights, whether it's education, children, public health, scholarships, as citizens, or if not beyond. If you don't give them access, they actually complain and demand it as a right. So I think that's something to understand, because Singapore draws, people who want to derive benefit from it, right? So we have a large portion of people who are driven to Singapore because they believe there are benefits they can get, whether it's a job, it's a scholarship, or others. And should they not get it, they demand for it as a right. So this has an impact in terms of citizenship discussion, because for the voting public in Singapore, they have long felt their status has been threatened, and in fact, the government treats them as second-class citizens. So the citizens actually feel that they are being treated as second-class citizens, and on occasions that they don't even get the benefits that they should be accorded to. So part of it comes from the perceived, and I use the word perceived because you can debate about whether it's perceived or rigid, in terms of the loose criteria or easy access for residency in Singapore, or even citizenship in Singapore. Something that is very, very different and rigid in countries such as Malaysia, Thailand, Indonesia, and Philippines, all of whom are, represented here. So I'll now so I provided you a bit of a long context, and now I'll just, dive into three key points in terms of the public policy formulation and, where are the key areas. I'll begin first with the political one. The COVID impact really dawned on Singapore from late March to April. And the first reaction for the sitting government was to call for an election. Right? So I think that's something people forget. But I think important to remember that was the first thing they did. And they called for the election in 23rd June, within 2 months. So you can see in terms of priority, what was that. It was a fully online election with just, voting that was public. I participated in the elections, so I have first-hand experience in campaigning online, and the challenges and the right, as was mentioned, of the Ratchathani, right, citizen in actually being able to engage with fully. There were a lot of lapses in the electoral management process, including health protocols. Candidates such as myself or voters were not given, health equipment or protection, while the election officers had PPE at the polling stations, and independent election observers or polling agents, we call, disappeared. They abandoned the polling stations when the election officials came with full health gear. So those are issues I think people forget, but was very real, more than a year ago in the context of Singapore. And as a reflection, as you have a political challenge in Singapore, Duterte's term is coming to an end, and we don't know when that election will be called. Indonesia, you had your what I call local elections not too long ago, and then and also Malaysia, looking at the implication of political change. The second point I'll make is what I call the securitization or the policing of health protocols. The mask wearing, if you bridge, mostly it's around mask wearing. And here, I will share screen from that Facebook page. There were fines, there were jails. Just go down to the next, after this, yeah. Like this guy is in the news. Mask wearing, so there was heavy policing. It was also indirect policing because they use things like social distancing officers who just wear a t-shirt with the term social distancing, but they have very strong powers, including the right to enter your room, your home, to check on you. So a lot of these powers were not articulated publicly, were kept hidden, and then as and when incidents happened, more and more people came. Now the policing was quite severe, especially for people who refused to wear masks and so on, because there were also, mental health issues, political positions and all of that. And these laws didn't take these things into account. And, because we have such a high percentage of foreigners, as I, signposted for you earlier, one of the punishments is really deportation. So like this guy, after he served his jail term for not wearing mask, he was, he's British and he's scheduled to be deported. So we have a whole range of incidents like this across the COVID-19 period. Related to
Dr.
this,
James, we have 3 minutes.
Okay, thank you. I'm wrapping up shortly. Is digitalized vigilantism. So you will have people, taking photos of anyone not wearing masks, posting on different social media. And that's why I'm showing you this page. And it creates a lot of, anti-foreigner sentiment and hostility to others. And last but not least is the collection of data, because Singapore is so surveilled and highly tracked movement control, and you have to, either have something like a Trace Together app or a token in order to have, a full oversight of people movement data. When this was first introduced, there was a lot of, public debate and concerns around data privacy. And a lot of assurance were given to the public that their data will not be, stored or used indiscriminately. But during question time in Parliament, it was revealed that actually data collected from this was used in a criminal case. And because there was such a huge public outcry, they then made a backtrack, amended the law and said it will be used anyway for serious crimes. So broadly, in short, I think we have the debate is about policies, health policies related to the rights of vaccinated and unvaccinated. I think the discussion of rights go beyond citizens. and also includes the large foreign population and their demand for rights vis-a-vis the rights of the citizens and the perceived difference between the groups. And also I've mentioned the highly policed, compliance regime and the deportation of foreigners for offenses related to this particular time, digitalize, vigilantism and what that means. And finally, the collection of data and concerns of privacy. So thank you very much.
Thank you for sharing. So we have a questions that from the question pool. So I already typed it on the chat. So on what grounds can people refuse to get vaccinated when a government mandates COVID-19 vaccinations?
Right now, there is no mandate. It's not compulsory to be vaccinated. From the state and government point of view, it's all about PR, promoting and encouraging and educating and so on, getting people to vaccinate. And then, of course, your rights, right? The idea here is if you are vaccinated, then you have more access to public spaces, events, activities, and so on and so forth. But the other dimension I think that's more significant is the whole digital vigilante, right? People who try to call out others who say they don't want to be vaccinated or don't think vaccination is a good idea. So I think that's the issue. So in short, Singapore doesn't have a compulsory vaccination regime at the moment.
Thank you for answering us. So for those who just throw questions to the chat, we will save your questions until the end of the sessions, and we will try to answer every question. So we have a lot of questions now. So move on to the largest country in Southeast Asia, Indonesia. Selamat datang. Okay, welcome. So I would like to introduce the next speaker from Indonesia, Dr. Suyani Indriastuti. Hope I could get your name right. Okay, Faculty of Social and Political Science, University of Jember, will share us the view and discuss about the lesson learned from Southeast Asia from Indonesia. So please carry on. Thank you.
All right, thank you. Good afternoon, everyone. Before I start my presentation, I would like to thank to Dr. Gomez who invited me, and also Art who always help me and chat me to join this event. And also I would greet the panelists, Dr. Arunee, Mr. Abdulsuko, and other. Nice to meet you, and also the participants and audience. Nice to meet you. I'm Suyani Indriastuti from the University of Jember, Indonesia, and I'm happy to join this event and also to deliver my knowledge and also observation about COVID in Indonesia. If I'm not mistaken, it's my topic to talk about Indonesia, I think, yeah. Well, please allow me to share my PowerPoint. Okay. So I'm going to start with COVID condition in Indonesia. Well, it's really sorry that Indonesia is the biggest, I think, the country that impacted the worst impact of the COVID in Southeast Asia. Compared to other countries, Indonesia has the worst situation in Southeast Asia. This data is from World Matter about the COVID cases in the world, and this is COVID cases in Indonesia. We can see that there is a trend, increasing trend of COVID in Indonesia, even though in recent times, in these months, there is a decreased trends, but I'm not sure about the validity of the data. But according to World Matter, there is increasing trends in Indonesia. Well, besides that, I would say that be curious about the validity of data, even though it is for the world matter or for Indonesian government, because in fact, there are different data between national government, local government, and also some what we call it, some NGOs. They have different data about the COVID cases in Indonesia. So it raises our curiosity about the validity of the data. Is it true like that? Yeah. In my observation, I'm afraid that the data is more than the actual data is more than that presented in border matter or government, because the government data is only based on the cases recorded in the hospital. And in fact, there are many people who stay at home and they are infected by the COVID. And I think they are not recorded by the government. So, and this number is high, and some activists even say that it could be 3 times higher than the presented data. So that is what I say. There is a different data between the national government and local government. The red one is national government, and the blue one is presented by regional government. Yeah, as you know, there is a regional autonomy in Indonesia, and national government can count by themselves, and also the regional government also do the same thing, but the result is different. And then, okay, so this, I think this is similar, or maybe can be evidence what Dr. James said, that there is a problem in information and also in data in Southeast Asia. And that's what happened in Indonesia. There is a validity issue about the data of COVID-19. Well, I will move to the government policy in Indonesia. So it is debatable in Indonesia about lockdown and government policy, because the government always say that, yeah, it's lockdown, but the NGOs or the community say, but it's not. Yeah, because according to the law number 8, 2018, what is called lockdown? Lockdown is staying at home in total, and the government has to guarantee about the fulfillment of the basic needs of the people. But in fact, it's not like that. So many activists, also media and others, say that in Indonesia, government does not implement lockdown, but it's semi-lockdown. So we have 2 schemes here: large-scale social restriction, or in Indonesia, we call it as pembatasan sosial berskala besar, or PSBB. And the second one is a community restriction, or pemberlakuan pembatasan kegiatan masyarakat, or PPKM. So if you read media in Indonesia, they will talk about PSBB or PPKM. That's the government policy that we can consider as semi-lockdown in Indonesia. So I'll show you at glance a brief about the large-scale social restriction. So yeah, we can see that PSBB is implemented by the particular province, that if they have the bad situation, if they have a high percentage of COVID, then they have to implement PSBB. But if the other province different situation, I mean, if the COVID is not as worse as that province, then they will not implement the PSBB. So the PSBB is not obligated to all provinces in Indonesia, but it's based on the condition in a particular province. Yeah. And so what the consequence of the implementation of PSBB? So the government have to give social safety net to the people, but it's not a full guarantee of basic fulfillment, basic needs fulfillment, but it's only social safety net, which is for some people it's not enough because the amount is not enough to fulfill their needs. Yeah, so we call it family hope program and cash intensive work, and then basic food cards, job cards, electricity subsidies, and then also direct cash assistance, special social aid for the Jakarta only. And well, this is the government policy. This is the top down and the protection imposed by government. But at the implementation level, there are so many problems actually, because there are so many requirements to get this social safety net. Many people that live in remote area, and also people that maybe they are not registered in some cards, they are not allowed to apply this social safety net. So I'm afraid that this social safety net is only for particular people, but not for all vulnerable people, I think, like that. Then I'll move to the second aspect about the PPKM or community restriction. Well, there is a different level. So the government measure the situation in Indonesia and the situation in particular city about the COVID. There are 4 levels: level 4, level 3, level 2, and level 1. Yeah, and this is like rearrangement about the activity of the people. So the PPKM level 4 is like this. Is the government imposed the highest prohibition to the people to do activities, because they have to do work from home 100%, and also for non-essential works, and for essential works like banking or hospital or others, they can do 5% and divide it into 2 shifts, that they have to apply health protocols, strict health protocols like that. Yeah.
And now we have 5 minutes left.
All right, thank you for the reminder. Yeah, terima kasih. Yeah. So this is the different levels, level 3, and then this is level 2. Yeah, it's not 100 work from home, but it's already allowed to work from office. But the requirement is the people who come to office have to be already vaccinated. And then this is the level 1. This is the it's only implied to the province that only have little cases of COVID-19. Yeah, so we can see that this is the map of Indonesia, and the red one is for level 4, and then the orange one is for level 3. And the light orange is for level 2, and there is no level 1 in Indonesia currently. So yeah, we can consider that is still higher rate of COVID in Indonesia. Next, I'm going to talk about vaccine. Currently, the same with other countries, Indonesia also obligates the people to get vaccine, and we can see that the number of vaccine in Indonesia also increase from time to time, and hopefully in the next year we already have full vaccine. But still, there is a problem in implementation about the vaccine obligation because there is a culture in Indonesia that is not a belief about the vaccine, and it's also about the what we call they're afraid about the content of the vaccine that may hurt themselves. And I think the government should educate the people about this. And yes, next, I'm going to talk about the people respond to the government policy. Yeah, in fact, in Indonesia, there are many people who believe about COVID and obey to the government policies. But there are also people who believe on COVID, but they they disobey government rules, and many people not believe about COVID, and as consequence, they disobey about the government rules. Why this occurs? There are several economic conditions due to COVID that enforce they have to go outside. They have to go outside, and also they have to not obey the government policy. And there are a tendency of distrust to the government because there is like government always change the policy often, so that the people think that what happened with the government? Is that true that we have to follow this, or we have to follow that? And there is a problem of socialization. And I think similar to other countries, and also what Dr. Gomez already talked about, the internet, in communication in internet, and there are so many hoax occurred in Indonesia too. So it encouraged distrust to the government. And the last, I talk about the culture. Well, many people think that the culture is more important than COVID. For example, about the wedding party, or maybe other ceremonies, cultural ceremony, they think that it is important and they have to do that. Even the government prohibited the event, but they just do it. And in some areas, there is a problem of law enforcement in which the government doesn't punish the people according to to what they do. And yes, that's the problem. So many people then just do what they want. They don't use mask, and they have like going to crowd, and also they have parties and others. But yeah, that's the situation, and we do hope that Indonesia get better from this COVID pandemic. Thank you.
Terima kasih. So we have a questions from the question pool to ask Dr. Suyani. So
Yes.
It's very interesting question for me. Will Southeast Asia become the next European Union or EU in terms of freedom of movement and currency union? So please clarify us. Thank you.
Well, before I explain or answer this question, I would say that maybe it's a bit hard to achieve the situation. Maybe a bit hard to achieve the freedom of movement, and also about the what we call currency, single currency in Southeast Asia, in ASEAN. Yes, ASEAN already has ASEAN community, which has ASEAN. We have ASEAN economic community. But the question is, can we really realize or achieve this purpose? Because before pandemic COVID-19, we already encountered hard situation, and now we encounter COVID. I think it's hard. I think we have a hard time to find this. Compared to the Europe, as Europe is a long journey or long process to get the current situation about the integration, economic integration, and even political integration in Europe. It's a long journey. I think from 1990s, from European Economic Community, and then European Community, and now they have Euro or single currency, and it's a long process to get that. And we can see also that there is a Brexit with British or United Kingdom exit from Europe Union. This shows that there is a problem in Europe Union itself, and this we can, maybe it's hard for Southeast Asia in this situation, in this pandemic situation, to achieve, but we can try, and hopefully the government of Southeast Asia can achieve that someday. Yeah, thank you.
So thank you from the voice of Indonesia. Terima kasih banyak. Okay, so the next one, the next country. So for the rest who still have a question, please throw the questions to us, so we will have the Q&A session. So the next voice is the voice from Malaysia. So may I invite Dr. Benjamin Y.S. Law, Senior Lecturer, School of Media and Communications, Taylor University, Malaysia. So Wen Ying, okay, welcome. So please proceed to sharing your thoughts and discussions about lesson and learn in Southeast Asia.
Thank you very much for that, Artino. Thank you all so much also, especially to Dr. James Gomez for inviting me to be present during this presentation. The report presented earlier was definitely very, very interesting, and I'll be very happy to sort of go through it more in depth. So today I will be talking about the issues of human rights within the Malaysian context as the voice of Malaysia. So if you've been following Malaysian news, we've got quite a bit of action that's been going on this week. Hold on, let me just share my little screen to show you my slides. All right, so for the session that I have today, my topic is going to be called Societal Leakages and Democratic Suppression in Pandemic-Ravaged Malaysia. All right. So what's happening in Malaysia? So if you've been following the news in Malaysia, we are currently going through a bit of a political crisis at the moment. Our Prime Minister resigned earlier this week. We currently have no government in place. The Council of Rulers, I believe, are meeting today to decide who is going to be the Prime Minister that's going to take charge. But essentially, the resignation of Muhyiddin Yassin sort of caps off his very, very troubled 17 months in power. And how has that sort of translated or affected the COVID-19 response? Let me just sort of highlight that this was, we have been in a very, very unstable state since March 2020, when the then government at the time, the Perikatan Nasional or PN government, took charge in what we refer to as the Sheraton move, where the previous government coalition collapsed due to party defections, essentially. So this new government that took over was in a very precarious position its entire time, and was essentially seen as focusing on defending its own position rather than managing the pandemic. And the sort of like the culmination of that was when one of our local state governments actually also collapsed due to defections as well, which triggered a state election. And then subsequently that caused a massive spike in cases that our country has not yet recovered from. So here's a very rough timeline of COVID that's happening in Malaysia, essentially. Wait, let me just hide this little thing here. Oh, never mind. That basically, we got our first case back in February 2020. And then we entered into lockdown in middle of March, and that ran all the way until May. And as you can see from this graph, back then, our case counts was incredibly low. The lockdown was seen as quite successful. We pretty much shut everything down. And come May, we were already in sort of like a recovery phase, and we had reduced a lot of the lockdown restrictions, and we were sort of like going back to normal. But then, as you can see, when the Sabah elections, state elections happened in September, that was when the cases started to rise fairly quickly as a result of that. And then we went into second lockdown, and our country then went into a state of emergency in January this year. That sort of like knocked the cases down a little bit, but then it went up again because our lockdown, I think similar to the case in Indonesia, our lockdown was not a full lockdown. There were a lot of holes in place, which subsequently meant that we initiated another lockdown immediately after. But this was supposed to be what we refer to as the full lockdown. But as you can see from the number of cases, that didn't even have an effect on the cases. And we are now dealing with, on average, at least over 20,000 deaths on a daily basis. And our death counts we are hitting 3-digit death counts on a daily basis as well. So we are in a very, very precarious state. But before we go into that, let me just go back to the year 2020, where things were all kind of very, very positive in the way that we were handling COVID. I think a lot of foreign media were sort of like presenting Malaysia as like one of the best examples of how to handle COVID. Why is it that we were so successful? And the way that we did it essentially was that we just focused on having lockdowns. The main goal of our healthcare COVID policy was really just to flatten the curve until we hit herd immunity via vaccinations. That was really the entire game plan that we've been following, and we're still following that until today. So initially, when they first announced the lockdown, the government did present a very extensive financial support and stimulus and welfare package, which included a loan moratorium that covered almost all loans out there. There were a lot of cash handouts given to people in various segments of society, and there were a lot of protections given to salaried employees and also small and medium enterprises, essentially, to sort of make up for when businesses had to shut down or people could not work, essentially. What was problematic about this entire policy was that the government instituted a lot of these sort of standard operating procedures, or SOPs, that were basically the list of restrictions that people could or could not do during this lockdown time. And while these are quite normal and expected during any lockdown, what was problematic in Malaysia was that these SOPs tended to change weekly or sometimes even on a daily basis. You would get a set of rules on Monday, and by Tuesday, those rules would be completely different. And so because we always had all these new rules and they always change, there were often the way this was communicated to the public was problematic, because sometimes they would announce it on television, sometimes they would announce it just in the news, and sometimes they would just distribute it online on social media. So it was very, very uneven, and it did not really sort of like work very well in that sense. And so the government was sort of seen as being rather short-sighted in the way that they handled the pandemic, and they didn't really think through a lot of these SOPs. There was not enough transparency in the rationale and reasoning behind many of these SOPs that they had put into place. And so a lot of people were fined almost on a daily basis because people just didn't know which rules to follow and which ones were the ones in place at the moment. And then on top of that, when the lockdown was first instituted, even though the government did present a lot of these economic stimulus packages, there were still quite a lot of leakages that resulted from the pandemic. A lot of marginalized and vulnerable groups were greatly affected by the lockdown. This included homeless groups, migrant communities, LGBT communities, those living in rural areas, and of course, various indigenous groups. The main problem with it was that because on a normal day, a lot of these groups are often assisted or serviced by various welfare non-governmental organizations. But due to the lockdown, many of these NGOs were suddenly unable to operate due to the many travel and operational restrictions put in place. So at the time when the NGOs were sort of crying foul over this thing, the government stepped in very quickly and just said that, oh, we'll take over all of these things, you don't have to worry. But they were incredibly slow in trying to sort of address these things. Many of the measures that they put in place, like preparing mattresses for preparing a homeless shelter. This was something that was only done in April, which is almost a whole month after the lockdown had begun, and certain groups like Orang Asli communities who were supposed to receive food aid did not receive them despite what ministers had been saying. Another aspect that has also been sort of like problematic or been left out are the informal sector. So in Malaysia, we have a fairly big informal sector, which is comprised of people who are working jobs that are not really tracked in any way, shape, or form. Doesn't necessarily mean that they're illicit. So these are people who are running roadside stalls, they're running side businesses, they're doing paid care work for families and whatnot. All of these sectors essentially were shut down, and because they're often not formal businesses, they could not receive any of the benefits that came from these stimulus packages as a result of that. Another thing that has really come about very, very strongly, and I think this is something that's mirrored very closely to what's happening in Singapore, is the rise of xenophobia towards various communities, and especially for migrant worker and refugee communities, because they were seen as clusters and causes for outbreaks in the country, essentially. And the reason behind this was because most of these communities, people in these communities tended to live in very squalid or inhumane living conditions, which meant that the coronavirus would spread very, very quickly under these situations. So whenever any of these migrant enclaves were found to be a cluster, they would often be sealed off under using barbed wire under military watch, essentially turning them into very, very large prison camp areas in the middle of the city. A lot of if you're actually interested to know more about this, I would urge you guys to check out Al Jazeera's 101 East documentary series called Locked Up in Malaysia's Lockdown. It's a very thorough investigation of this entire situation that happened in the middle of last year. Another group that was heavily targeted as well was the Rohingya refugee community that we have in Malaysia, because there was a cluster that appeared in one of the markets that they were sort of like often their migrant enclave was based around there as well, which then started this very big call for of xenophobic chants from many people in Malaysia who wanted these refugees to be kicked out of the country, essentially. So in a lot of these cases, the government may not have actually sort of added to the xenophobia, but they did very little to stop it. And in certain aspects, they kind of subtly encouraged it, in various speeches from ministers and also the Prime Minister, they did mention that many of these cases did come from these migrant groups and communities. And while the way that they mentioned it was sort of reckless and did lead members of the public to jump to certain conclusions as a result of that. We also had a lot of problems with our ministers who engaged in a variety of PR gaffes, essentially. Our health minister infamously said that drinking warm water can kill the COVID virus in your body, which he was then attacked massively for. We also had a minister who did an unnecessary PR stunt wearing PPE suits. This during a period when we had a national shortage of PPE equipment. Our Ministry of Higher Education also promoted a very bizarre TikTok competition when university students were struggling with internet access for online classes. And then finally, of course, we had the Ministry of Women, who then put out this sort of like recommendation that wives put on a squeaky voice so they sound like a cartoon character to maintain their marriage, essentially. So a lot of these things came about during this and a time, which led people to then which further eroded the trust that people have within the government that they had. And so to add together to this, we also had this sort of built up this idea of the infodemic that happened in Malaysia quite a bit, because people were losing faith in the government, the health policy was a bit problematic, and this started to build as well as we had quite a bit of vaccine anxiety earlier this year due to the very, very slow and oblique vaccination process that we had in place. People were struggling to get vaccinated, and even if they wanted to, the processes in place were very slow, and there was no transparency as to where you were in the line and whatnot. You just received a message in your phone saying that you have an appointment, but no other details beyond that. And so this force made people start to clamor for a lot of alternative information as a means of claiming more controls to protect themselves. So people started to share news regarding homebrew remedies such as vitamin C. More recently, we're starting to see a lot of news regarding the use of ivermectin to treat COVID. So a lot of discussion is taking place there as well. Even as our health ministry says that this is untested, please don't do this. There was quite a bit of discussion over which vaccines to take as well. We had a lot of news stories of people rejecting the Sinovac vaccine because they were afraid they would not be allowed to travel to certain countries as a result of that. And then finally, there was also a lot of concerns about whether these certain vaccines were halal or whether they had certain elements that people didn't want. So a lot of this information was spread around quite a bit, and the government was very, very slow, or even if they wanted to address them, because people didn't really have faith in the government, there was very little they could do directly in that sense. Okay. So that was technically all of what was happening in the year 2020. So when we go into the year 2021, that's when our health system is really starting to fail, essentially. We start our second lockdown in January together with a state of emergency. And by this point, our economy is essentially battered. We've been going through a lockdown for almost a whole year at this point, and the economy cannot sustain it anymore. So when we went back into a second lockdown again, the government was unable to provide proper economic relief on top of that. So the lockdown that they implemented was very uneven, again, similar to Indonesia, where certain sectors were still allowed to operate despite the name. The loan moratorium that we had before, which was universal, was now conditional only. So people were not happy with that. There was some cash handouts given, but it was very limited in nature, not as much as before. And one big thing that they introduced was they allowed people to withdraw from their retirement savings. And this was to indicate how dire the situation was for Malaysians. Our Ministry of Finance actually said that by the middle of this year, a third of all retirement savings, people with retirement savings only had less than 5,000 ringgit in their account. That's a little over $1,000 for their retirement. That's how bad things had become, because people were just drawing from their retirement savings just to sustain themselves. And despite the fact that we had this second lockdown, new cases continued to rise, not almost unabated, essentially. The Delta variant was wreaking havoc on everything. We also started to see a large number of what we refer to as brought-in dead cases, whereby these are people who never even made it to the hospital, or the hospitals were so full that we were forced to try to weather out COVID at home. And as a result of that, we are seeing a large number of people who are just brought in dead, essentially, as our ICU and hospitals are at over capacity, essentially. So this
Benjamin, we have one minute left.
1 minute left.
Thank you.
Okay, I'll try to speed it up.
Okay.
So now we're starting to see also that as a result of that, people started to clamor towards this sort of like this very, very negative response towards the government. This statistic came out that 4 suicides started to happen a day in the first 3 months of 2021, and 2 very, very big hashtags came out, which was Kerajaan Gagal and Kerajaan Pembunuh, which respectively means failed government and murderous government, as they were blaming the government for the problems that Malaysia was facing and for all these deaths that were coming, essentially. So now I'm going to talk a bit about the attacks and the restrictions on the media from COVID. So we went into a state of emergency in January. Originally, it was intended to be for health policy implementation, but in essence, a member of the government actually admitted that this is a political emergency, meaning that all they did was suspend parliament, make sure that no elections can be held and that no street demonstrations can be allowed. They introduced various new emergency ordinances, including an anti-fake news bill regarding COVID, essentially. So while there were numerous arrests related to it, it was unclear whether this anti-fake news bill actually did anything beyond that as well. And also we started to see a lot of comments or critical comments against members of the government were heavily restricted. So we started to see a lot of punitive charges against criticism, regular citizens who just criticize members of the government or ministers. They were often attacked, be it lawsuits using the Penal Code, Multimedia and Communication Act, or the Prevention and Control of Infectious Diseases Act, essentially. So targets were just regular people, political satirists, and the like. So this was what the members of the government had essentially been engaging at to sort of restrict or attack people's freedom of expression. We also started to see a lot of attacks against the media. Our top online media outlet, Malaysia Kini, was charged with contempt of court simply because somebody posted based off a comment that was posted on their website, and that caused them to receive a 400,000 ringgit fine, essentially. The documentary I mentioned earlier from Al Jazeera, the journalists involved there were questioned by police, and eventually their journalist visas were cancelled and they were deported. Asra Awani also was charged when a newscaster actually said on live television that something very defamatory against the police, and the police have actually taken legal action against the broadcaster. So we also have a lot of street protests that have been happening in 2021. We are seeing, a lot of youth-based movements demanding for the reopening of parliament, for the ease of restrictions on lockdowns. We had also a group of contract doctors who wanted better pay throughout the pandemic, and all of these things tend to be responded by police trying to calling them up for interviews, showing up unannounced at their homes, and essentially these forms of police intimidation are meant to silence these discussions. And just last night there was a candlelight vigil that took place in Kuala Lumpur, and the organizers were actually arrested by the police and given a very, very hefty fine for participating as well. So that's essentially the state response that's greatly limiting a lot of this democratic engagement. So moving forward, this is my last slide, so I'm about to end. Thank you so much. But right now, our Council of Rulers is still discussing who's going to be our new government. But with a new government, what are the possibilities in place? So it regards to the bigger questions to us, there's still a lot of uncertainty of achieving herd immunity due to the Delta variant. So as a result of that, I believe that the government needs to stop being overly reliant on lockdowns, as it's very clear that it's no longer effective, and we need to move towards a more mitigation approach to handling COVID, essentially. Because of some discussions that are going on right now, there is a possibility that we are going to have a unity or minority government in power, and this is going to be an interesting opportunity to see if we can push for much needed political reforms in the hopes that a situation like this will not happen again, essentially. But one of the big things that I'd probably like to say to the new government is that there needs to be this, they have to stop attacking the media and to reopen civil discourse, because that has been greatly hampered in the last year and a half in Malaysia, and we really need to reopen that space. So that is it for my presentation today. Thank you so much for giving me the time to present this. I'm sorry if I've gone over time. Over back to you, Artino.
Okay, so your presentation is quite hot because we have 2 questions to. Okay, I already typed in on the chat already. So what are the first question is, what are the government policies, measures that shall be implemented for the situations of COVID-19's post-crisis on economics and food security in Malaysia? And last one, I really like the question, should a general elections be held during the time of the crisis in Malaysia or not? Thank you.
Okay, thank you for that. So for the first question, that is a very, very tricky question. Currently, our government, only a couple of months ago, they've actually announced a proper plan of recovery, a recovery plan for the country, whereby we are divided into 4 phases, and most of the country is still currently in phase 1 and phase 2, essentially. So at present, we don't really have a post-crisis mode. So as I said before, currently right now, unlike most other places, when governments announce lockdowns, there's often an end date. Malaysia currently is in an indefinite lockdown. Our lockdown now has no end date in sight, and there is no suggestion to indicate there's anything coming up as well, as our case numbers continue to rise with no end in sight, essentially. So for me, I would say that the biggest issue that they're probably going to do is to, of course, address economic issues and food security. But the problem also is that despite the fact that there were leakages from the pandemic that I highlighted before, with many of these marginalized groups already suffering, people in the general public of Malaysia are also suffering and have gone through a very, very hard period during this time as well. So it is going to be very difficult for Malaysia to draw on its very, very limited resources after going through this very harrowing time, essentially, to see how they can spread out to make these policies be as inclusive as possible. I'm not a political scientist, so I can't go into too much. I honestly cannot go into too much detail about that. But that is basically something that the Malaysian government has to make very, very hard decisions to make sure that they get as much coverage of Malaysia as possible as we exit this crisis, essentially. But I think for now, we still need to really focus on trying to keep the numbers down to get everything in check. And we need to really stop Malaysians from dying from COVID, essentially, because that has really become the reality of what we are going through at the moment. So the post-crisis thing is still very, very far away now at this point. On to the second question about the general election, I believe that democratic processes should not be stopped due to COVID, but at the same time, I also understand that the previous government has not actually done anything to facilitate the holding of general elections. During the state election that was held in Sabah, which caused the spike in cases, I was actually on the ground there as an election observer, and the many SOPs and regulations that they had in place were really not enough to ensure that that would have been a safe election. That is the crux of it all. Our election commission has not really pilot tested or even tried to make any new approaches of trying to make an election COVID safe, essentially. We don't have any processes that allow for general postal voting. We don't allow for people to choose. We don't have an extension of voting periods to really allow for it to be done in a very safe manner. So while I believe that we shouldn't suspend democracy due to COVID, I also don't believe that Malaysia is in a position to actually have a safe general election. So for me, I would say that that is really not something that we should go with. Okay, so I think that's about it. So thank you very much for that, Artino.
Thank you. So I would like to pass to last but not least countries. The voice of the Philippines. Okay, I would like to invite John Phillips, Binondo's assistant professors lecturers from the LSU, Manila's International Studies Department. So please share thoughts about a lesson learned from Southeast Asia from the Philippines. Thank you.
Thank you very much, Artino. And I want to also thank all the previous speakers for really laying the context about this discussion. And just like to ask forgiveness if at the middle of this presentation I might end up coughing or my voice gets even worse. So I do apologize for that. But allow me to first share my screen. So good afternoon to everyone. And thank you for still being here. We've had quite a number of speakers already who have really informed us about the different situations across our Southeast Asian region. And I really look forward to, oops, sorry. I think I'm trying to share the PowerPoint. And I really look forward to adding to this conversation. So what I will be doing today is I'll essentially be, since as you have seen, as you might have already noticed, there are quite a number, if we look at the facts, if we look at all the policies that were implemented across the different countries and even in the Philippines alone, you will notice that we could get a general feeling of overwhelm. So my goal today is to really focus on a couple of things. And since we're approaching this from a human rights perspective, my idea is to really bring the discussion to the center of both civil and political rights, as well as economic, social, and cultural rights. So I apologize. I'm still just having some struggle with sharing the screen, but there we go. I think I found the right one. Could I just get a confirmation that you could already see my screen?
Yes, we can see your screen.
We see your screen. We can
Perfect.
see. We can
Thank
see.
you. Okay, I will just go ahead and load the go to so within a span of around 14 slides, I'm going to talk about the situation of COVID-19 in the Philippines and what are some of the distinct differences that we have experienced here as opposed or as compared to some of our brothers and sisters across the continent. So from these images alone, you will see that really my discussion will try to focus mostly on the disproportionate impact that COVID-19 has had on the vulnerable and marginalized groups and communities within the Philippines. And this is primarily because of what we all know here in the Philippines as the ECQ, or the Enhanced Community Quarantine, which I'll talk about a little bit later. So to move forward, there are 5 points that I will discuss. First, I will engage you with a short situation, or what is the current statistics that is of relevance to us in our discussion, and what has been the COVID-19 response and protocols of the Philippine government. And then I'll try to identify some general trends and observations based on the things that I have mentioned, that I will have mentioned before that, before moving on to a more human rights centered approach by looking at the consequential and unintended effects of these responses and protocols, which to a large extent, similar to what has been talked about earlier in a lot of Southeast Asian countries, this disproportional and unequal impact, and further, an impact that has further widened the gap of inequality. And lastly, I'll try to share some parting thoughts on what the new normal could possibly look like, and perhaps what the new normal should try to take into consideration. So moving on, compared to other Southeast Asian nation countries, the Philippines is perhaps somewhere in the middle. But if you take a look at our current cases, which is over 1 million with almost 15,000 new cases on a daily basis, you will notice that the situation indeed is not as promising as it once was. And there could be a lot of factors that could explain this, with the new variations of Delta and Lambda. So it's not only about the government's response in regard to the protocols and measures that have been put in place, but you can see that our cases really started as early as February of 2020. And for the first year, we were able to pretty much manage it, even lower the number down. But things started to pick up again around March, which led to another lockdown. But as of the moment, we just are about to end today an enhanced community quarantine lockdown that lasted for 2 weeks. So indeed, the case of the Philippines is interesting in different facets. So what has been the primary responses and protocols from our perspective or here in the Philippines? So the main focus really has been to try to implement community quarantines, which can be defined or which can be simply called encouraging people to stay home and really practice physical distancing or keeping apart from one another. And this very popular meme you'll see at the lower part of this presentation, at one point, Philippine government officials were even encouraging people within the same households to maintain social distancing and wear masks, just because they were concerned about growing number of cases and how we should be able to really manage this problem. Although, of course, there's a better understanding now, but this particular meme really captures some of the complexities given the density of Metro Manila, which is actually composed of multiple cities and a municipality here in the center of Luzon, the main island, and where the seat of government also is. But this stay at home has really been the main thrust of our response and protocol towards COVID-19. And as time has passed, this has also evolved. And as you can see, our presidential spokesperson has now talked about not only wearing masks, washing hands, and social distancing, but now they've already incorporated vaccination given the availability of vaccinations. Although this particular issue on vaccinations is also, also brings another element of complexity into this whole equation. But nevertheless, our protocols and responses to COVID can simply be summarized into wearing the mask, washing the hands, social distancing, getting vaccinated, plus the 3-3, or testing, tracing, and treating. Although as far as the T3 is concerned, we still have considerable problems in being able to contact trace and really isolate people who have been infected before they're able to indeed spread the virus. So that has been the challenge for us. So when we look at the vaccination, you will also notice that most of the vaccinations have indeed been concentrated in NCR, or the National Capital Region, or also what's known as Metro Manila, composed of several cities and a municipality, which includes Manila. So, and this is quite understandable given that Metro Manila is where bulk of the cases are. But as a number of cases have increased in other parts of the islands, we've also seen that they've also been able to secure their share of vaccinations. But indeed, the availability and accessibility of vaccines has become a wider issue, given that despite Metro Manila being the center of this epidemic, new centers have also emerged in islands of the Visayas and Mindanao, which has also made this indeed a nationwide problem. And for the vaccine tracker, you will also notice that a lot of the Philippines has mostly relied on Sinovac that has been both donated and procured. That has been the priority of the Philippine government. And this has also become a very politicized issue. So that is also something that's worth mentioning. But all of these will make sense in the state that, or in the conversation that I wish to further engage you with, which is to identify the general observations and indeed trends that we may notice from the Philippine experience of this quarantine. So among the first things that should be noted is that in the Philippines, we have been undergoing what is considered to be one of the longest ongoing community quarantines. So ever since March 16, 2020, especially for those residents of Metro Manila, we have pretty much been in one of these particular classifications, whether it's enhanced community quarantine, modified enhanced community quarantine, or a general community quarantine, or a modified general community quarantine. And similar to the case in Malaysia, the protocols and the SOPs were not very clear, although they were not changing on a daily basis. Nevertheless, there was still a lot of confusion. And worst of all, it even gave the impression that it was simply an alphabet soup of quarantine classifications. And these classifications are not even limited to the four you see on the screen. There even have been some extreme enhanced community quarantines, which have been granular, as they say, focusing on smaller communities within a particular city or district. So this community quarantine classifications has indeed been a very complex and confusing enterprise for us, which has not really necessarily been working to our advantage. But besides that, what's also worth mentioning about these particular information and data that I've already presented earlier is that a lot of the focus of the implementation on the quarantine protocols and measures have really been highlighting or have really focused on the discipline aspect of it. So I don't want to go as far as saying that this is perhaps a securitization or a militarization, although if you look at how the Philippine government is implementing these particular these particular policies, you might get the impression that indeed this health pandemic has a very militaristic approach in the way that it's being, or the way the government is attempting to solve it. And this brings it to the second conversation of how this interagency task force for emerging infectious diseases is one of the least diverse and representative IATF for a liberal democracy. So in this image alone, you can see that it's pretty much a boys' club. And not only that, although the cabinet of the president has 2 female members, they're not very visible during the meeting. So you really get a very different impression when the IATF meetings take place. And it's also worth noting that most members of the IATF are also either former military or former police officers, further giving us the idea or further strengthening this particular idea in the minds of people that indeed this public health issue has been politicized and the solution has been a more militaristic approach than one would really hope for. And lastly, among the important things to take note of is that the particular issues and problems that the Philippines has faced has really helped expose and uncover important public policy deficiencies that we've really failed to enact in the past. So from a perspective of not having one database for information on people so that they can indeed take benefit from the aid, from the social aid that's provided from the government, to not being able to also identify who are the people who should be prioritized very quickly for the vaccination. So again, the fact that we also don't have a CDC or a Center for Disease Control is also some of the things that this particular pandemic has exposed. So looking at it from a human rights perspective, indeed, the question now becomes, what are the effects of these particular policies being implemented, and how should we assess them from a human rights perspective? And there's really two things that I really want to highlight: is the consequential effects and the unintended effects. So in this particular image, you will see that what has happened in the Philippines is the consequential effects of this COVID response has really had a disproportionate impact on all the different social sectors within society, and has also led to this widening socioeconomic gap. So from the first image of bus drivers who are considered daily wage earners not able to earn as much money simply because they can't hold enough passengers, and that's because in the Philippines, public transportation is actually liberalized, and people or drivers earn based on the number of passengers that they carry. So the fact that they're not able to earn as much and they're not even allowed to apply the same routes has become a huge issue of, in certain cases, underemployment for them. And not only that, the reduced number of buses and routes has also led to a lot of people being stranded. And these are also other daily wage workers who either work in the service sector or in other sectors of society, from manufacturing, that that rely on public transportation. So these are the people who were not able to either go to work. And on my next slide, I'm going to show you the percentages of what the impact has been in terms of unemployment. And more importantly, also, when we talk about this from a and that was looking at the situation from an economic, social, and cultural rights perspective, and talking about it from a civil and political rights perspective. What you'll also notice is that for violators of these particular quarantine rules under the ECQ or GECQ, instead of these people's health being prioritized, you can see that the government was more interested in really punishing them and really making a show out of them just to discourage other people from violating these protocols. And this is also clearly seen in the example of certain violators being made to walk. So given all these particular situations, what has been the response in the Philippines, or how are the things changing? So as much as they've tried to encourage social distancing, as time has passed, a lot of people are now also going back to defying this, despite in public utility vehicles like jeepneys, there being dividers. Initially, the suggestion was that jeepney drivers only haul half the capacity, but since they're the ones, they depend on their daily wages, it's really difficult for them. So we're seeing that the full enforcement of these protocols are not really being upheld. And in this last image, and this is an image of overseas Filipino workers, as you all may know, the Philippines is one of the largest sources of human resources in the form of overseas Filipino workers. And since this pandemic, they have not been able to leave the country. They've been forced to come back and not been able to leave the country due to different restrictions. So they're also one of those groups that have been really disproportionately affected by this. To get into the details of this.
You have 1 more minute left. Okay, thank you.
Yes, I'll finish this very quickly. So as you can see, when we talk about the disproportionate impact, for those people who were either unemployed or underemployed, they point out that the pandemic has been one of the major reasons that they found themselves in this situation. And if you look at the numbers of unemployment, although at the moment we're coming back to a more normalizing number, at its highest, unemployment was at 7.23 in April 2020. So these are also issues of concern from our perspective. So lastly, just to talk about the unintended effects of COVID and also looking at the more civil and political rights in respect to education, and also different groups who also have not necessarily been noticed during this particular period is also noteworthy. So similar to other countries in Southeast Asia, we also have a huge disparity in people's access to education and information technology infrastructure, which has really made it difficult. And not only that, but the role of women and the added work that they have taken on, on top of doing housework to now actually being, the teachers of their own children has made it difficult. And it's not only students who have difficulty with online learning, but also teachers themselves are having a difficult time adjusting to this. But I also want to highlight the fact that during the pandemic, issues have also emerged concerning children and how they've also become more vulnerable to sexual exploitation because of the internet and because of the very difficult time some of their parents find them in. And also the shrinking democratic space is something that is worth mentioning, especially in the face of the closure of a major broadcasting company here in the Philippines, in ABS-CBN, and also the issue of red tagging or individuals being tagged as members of the Communist Party, which is officially considered a terrorist organization. So with these said, what are some of the parting thoughts that I want to share? What's important for us to be able to do here in the Philippines is be able to restore public faith in the rule of law and democratic space, things that have been severely affected by the pandemic, not necessarily as a consequence, but more as an unintended consequence. And what's important is to initiate policies that are more inclusive and informed about the different conditions of vulnerable populations, from women to children, especially women, and I did not mention this earlier, who have been also more vulnerable to sexual abuse and sexual violence within the confines of their own home, simply because they're forced into these spaces. So with that said, just want to also mention that ensuring a human rights-based approach is the best way to pursue the sustainable development goals and COVID-19 response measures, especially if we intend to live up the promise of leaving no one behind, as has been set out in the sustainable development goals. So maraming salamat po sa inyo. Thank you very much for your attention, and I'll be open and happy to accept any questions. Thank you.
Okay, there we go. So thank you for your great presentation. So the question for the Philippines from the question pool that we're gathering up. So those who just asked in the live, so hold your horse first. We will come to you during the Q&A session. So the first question would like to ask to the Philippines. How can you please share your thoughts for helping the Philippines against COVID-19? Thank you.
In terms of helping the Philippines, I did not really talk about this as much in my presentation, but perhaps one thing that's also worth mentioning is really strengthening our vaccination program. And part of that is combating this infodemic that has been spreading. There are quite a number of anti-vaxxers and doctors, Filipino doctors and influential doctors who have quite a strong social media following that discourage people from taking in vaccines, coming up with all these different explanations and conspiracy theories. So I think one way for us to effectively overcome this COVID-19 pandemic is to make sure that more reliable information is available to counter all of this infodemic information and fake news that is spreading. So as far as freedom of information is concerned, I think that would be an important area. But secondly, also, it's also very important for the Philippines and for Filipino citizens like me to take contact tracing more seriously. It appears that is where the weakest link of our government is. They are indeed able to identify people who test positive, but they're having a lot of difficult time in contact tracing who these people have really interacted with, simply because of the absence of one common contact tracing app. You know, local government units have a different contact tracing application, and a lot of times private establishments also have their own. And it's quite apparent that, you know, there is a lot of you know, there's not a lot of consistency in the kind of information that they're getting, and there is no central database. So that's perhaps some of the areas that can be improved to hopefully get the numbers down and get more information, get more accurate information about the pandemic in the public here in the Philippines. So thank you, Art. Was there anything else?
We will have during the Q&A session. So shall we begin the Q&A sessions shortly, because I have a lot of questions here. So I will start sequence by sequence. So Q&A session. So a lot of questions. So I will start from the Thailand category first, from Thailand and Deep South. So I would like to pose this now. So it's the question to Kun Abdul. Okay, from the southern Thailand. So I will post this right now, the first one. Okay, this is the questions. The first question says
ครับ
ครับเดี๋ยวคำถามแรกนะครับ Southern Thailand is for this question from Mr. Dr. Yoyo from Myanmar. So the question is, Southern Thailand is close to Malaysia. Is there any provisions from that country to the local people? ซึ่งคำถามว่านะครับใน Deep South ของ Thailand เนี่ยหรือว่า3จังหวัดชายแดนภาคใต้เนี่ยมีการกระจายวัคซีนหรือแบบฟอร์มนะครับที่สู่คนท้องถิ่นหรือไม่ครับ
ครับเขากระจายทั่วนะครับโดยใช้อสมเนี่ยไปเคาะประตูไปใช้ทั้งแอปพลิเคชันหมอพร้อมแล้วก็ให้อสมลงพื้นที่แต่ปัญหาสำคัญในช่วงแรกก็คือว่าความไม่มั่นใจในวัคซีนอยู่2ประเด็นที่1ในเรื่องของฮาลาลประเด็นที่2ก็คือประเด็นของซิโนแวคคุณภาพของเขาคุณภาพนะครับแต่อันนี้พอคนเสียชีวิตมากขึ้นนะครับสิ่งเหล่านี้ก็ทำให้คนเนี่ยเราเห็นภาพที่ปัตตานีเมื่อ 4-5 วันที่แล้วเนี่ยคนล้นนะครับทำให้ตอนนี้คือว่าวัคซีนไม่พออีกนะครับ
Okay, so move on to the next. Thank you for answering the question. So we would like to move on the next questions. I'm going to post this now. So this questions from Dr. Yoyo to Dr. Arunee again. So here is the questions. So the question states that did Thai governments announce a specific restrictions to Thai peoples as a measure of prevent apart from the rules of lockdowns and others normal practice? Thank you. So thank you for the questions. Okay, now you can begin to answer.
Okay, thank you. Can I share the screen? Okay.
You already shared,ครับ
Okay. If you see the red color, the red color is the prohibition from the government, and most of our restriction is like have the mask before you get out of your home and stay away from other people at least 2 meters, or mostly it's like normal restriction in the same with other countries. I think it's like a standard prevention that WHO suggestions, but in Thailand I think it has very special in the situation that has the restriction on the Facebook post or social media post because the government claim that the people fear of the vaccinations because if they have many data information about the people who got the vaccine, most of the people is the normal people, but not the vulnerable people that like elder or the people has the 7 deserts target group of the people that has the rate of death highly rate of death from COVID-19 because in the countryside the fake information or about the information that has not confirmed that true or false is spread widely on line application and there has no fact check that spread usually in everyone that to be formally that what is true, what is false. So many people in outside country is not trust the government also and not trust in the vaccination, especially the mix of mix of vaccine that Sinovac with AstraZeneca will make more distrust of the vaccine. I think this is the matter because it's the right on our body. It's the bodily autonomy. The doctor, some doctor claim that it has a valid research that the mixed vaccine is okay. It's okay. It's faster than AstraZeneca. AstraZeneca is faster than other vaccine, but the number of testers is only latest data is the 75 number, just only 75 number that to be used for the million number in Thailand. I think this is it make the question for the people and they want to ask, they want to express. So the government just okay, if you post something that make a fear, make people don't want to vaccination, so you will be sued by the government. This I think this is different from I think it's very in case in Thailand, like a authoritative government like that. Thank you.
Okay, thank you, Dr. Arunee, for the question. So the next questions I would like to announce here. So it's a question for Singapore. So Dr. Gomez, please stand by. So it came from Dr. Yo-Yo from Myanmar. So is there any people who are not able to be vaccinated in Singapore or not? Thank you.
I think the rate of vaccination is quite high. There are very, very small and anecdotal evidence only that there are people who are against vaccine and have not vaccinated or would not want to vaccinate. The other category of people are those with chronic illnesses and therefore are not advised to take vaccine. So in short, it's a very, very small number.
Thank you, Dr. James Gomez, for answering the questions. We'll move on to the question for Dr. Suyani. I will pose this right now. Okay, so I feel like I don't want, okay. Does Islamic belief have any effects on COVID-19 management between peoples, religions, institutions, and the local governments? So this is a question from Abdulsuko Dina from the Deep South Thailand.
Okay, thank you for the questions, Mr. Abdulsuko. Most Muslims in Indonesia believe, but I'm sorry, I don't have real data, but from my observation and based on what I read in mass media, most of them believe there is COVID. So I think COVID, they believe about COVID or not is not because of their Islam or not, but because of culture, as I said before, because of culture, but because of the religion. The thing is that is related to Islam is about the vaccine. It is halal or not halal, you know. Some people in Islam don't believe that vaccine is halal, so they reject to be vaccinated. They don't want to get vaccine because of that belief. But it just small people, because in Indonesia there is an association of Muslims like MUI, we call it. This is the biggest Muslim association. Not the biggest, but this is the Muslim association in Indonesia, and they said that vaccine is halal and people have to get vaccine in order to prevent spreading COVID to other people. And I think other organizations such as Muhammadiyah and also Nahdlatul Ulama, this is the bigger, they are two of the biggest organizations, Muslim organization in Indonesia, and they say that people should get vaccine so that in Islam we are not allowed to hurt people, and vaccine is one way to prevent we hurt other people. That's the belief. So if the question is about Islam and COVID, which is it belief or not, I think the problem is not related to religion to COVID, but only about the vaccine. Yeah, thank you.
Okay, terima kasih again for the answering the questions. So move on the question from our faculty's member. So I would like to share it now. So this question is asking the speaker from Malaysia, from Dr. Arunee, to ask Dr. Benjamin about the situation. So here we are. So the question is, how should the appropriate balance of power between the local and central governments in the time of COVID-19 outbreak?
All right, thank you very much for that, Artino. So for those of you who are following the news, I also just got news that our Council of Rulers has picked a new Prime Minister who will be sworn in tomorrow, and it's basically our former Deputy Prime Minister. So this is a sort of like not surprising. This is what we all were kind of expecting, but it basically means that we're going to get more of the same, essentially. He was from the previous administration anyway, and this was all just one very big political power play move that has played out pretty much to the letter as expected. As to the question at hand, I think it's very difficult because in Malaysia, in general, the way that our federal government works is that the federal government holds a lot of power and local governments are generally quite weak in comparison, except for a few major states which actually have a lot of economic power on their own. They rarely are able to sort of institute anything without sort of like the central government's assistance to sort of handle a lot of these things. So for the most part, our central government has actually sort of handled a lot of things on their own regards to the outbreak. So everything from the vaccination program to the healthcare policies in general. And in certain cases, there have been some sort of tensions between opposition-led state governments and the federal government. But for the most part, I would say that it's a good way for check and balance to happen, whereby there needs to be a way in which, because I think the biggest problem we have here in Malaysia is that there is just not a lot of transparency. Like one of the reasons why one of the biggest issues that we are seeing here in Malaysia is that we have a lack of testing with regards to the rates. You know, there's no transparency over how it's done, and the government also does not give out enough information about the state of the healthcare systems. They say that, oh, ICU capacities are about 100%, but in certain hot sort of like COVID epicenters, essentially the rate can be as high as 110 to 115% essentially. So they don't really give enough breakdown of the figures to give an overall view of the situation. So this is where state governments, especially the ones from the opposition, can come in to provide sort of like, I mean, on the one hand, you can look at it cynically and say that, oh, it's this, the opposition just wants to embarrass the federal government. But in doing that sort of embarrassment, it's also sort of like indicating that this is the reality that's there. But the problem, of course, is that when this is done, it further erodes public faith in the sort of like state institutions. So I would say that they need to work together. So I don't think we're at the same level of like America, where state authorities have pretty much all the power and federal have very little. But at the same time, I think that there needs to be a proper check and balance system between these two entities, essentially. And I think Malaysia doesn't quite have that, but it's something that I think each country will need to find their own middle ground to settle on in that sense.
Thank you for answering the question. So actually, this question is kind of the central questions. Would like to, from Dr. Arunee to chair. I would like to hear from Singapore, followed by Indonesia and the Philippines as well about the same questions about does the questions about how should the appropriate balance of power between local and central government in the time of COVID-19 outbreaks. I would like to hear the other case as well. Thank you.
Okay, I'll kick off with Singapore very briefly. Singapore is, just a city-state, so the issues of, provinces and all that are not relevant. But I think the key thing to take away is a central unit, meaning that everything is centrally organized, and it's, throughout its history, those who have been in power do not believe in or subscribe for the need of independent institution. So in the manner that, they are legally separate, they rather prefer honest people to be in charge. So that's the kind of the language. So if you argue for an independent election commission or an independent human rights institution, I don't think it's something that as long as those in power will support, and those who are ideologically aligned to those in power would support. So in that regard, I want to kind of throw back the comment back to Abdulsuko Dina, from Deep South. I think in his comment in Thai, he said, oh, Singapore looks successful in managing the COVID-19 and so on. But if that is a positive remark, and I can say the same also perhaps to Noi Noi from whether you would like the Singapore government to manage the Deep South.
3 จังหวัดชายแดนภาคใต้การบริหารตอนนี้ก็คือรัฐบาลบริหารอำนาจรวมศูนย์นะครับ
Sorry, so please finish for the Singapore case first. Thank you.
In the Deep South Wales, right, the administration that is very centralized. Yeah.
Hello, Dr. James. Okay. So, hello, Dr. James. Hello. Oh, okay. So for the next speakers, I would like to hear from the voice from Indonesia about the thoughts of the same questions. So please share, Dr. Suyani.
Okay, thank you, moderator. It's about the balance of power between national and local government. Is that correct?
Yes.
Okay. All right, thank you. Well, it's quite challenging in Indonesia because Indonesia is a big country and there is still issue about local autonomy in Indonesia, about the power overlapping of power and also policy between national and local government. And if the question is how should the balance of power, I think, well, between national government and local government, there should be a good coordination so that the policy is not overlap and even contradict between national and local governments. That what happened in Indonesia, that in some cases, the policy between national government and local government are quite contradict. So they have to make what we call it synchronization, or make good communication between them. Local autonomy in Indonesia quite good because it's local government have power and also have authority to handle the COVID in their area. But the thing is, sometimes the policy is different with the national government. So the communication and synchronization is quite important for doing balance of power between local and national government. Thank you.
Next, I would like to hear from the Philippines about the same questions before we pass to Abdulsuko.
Yes, thank you, Art, for asking this question. In the Philippines, unfortunately, since we're not a federal system, power is not devolved to local government units to the same extent it might be in some of the other cases like Malaysia or even Indonesia. So a lot of the power still rests within national government. It's just that in certain areas, there might be some allowances given to local government units to implement certain codes or ordinances. And perhaps the tension in that also comes in the particular time that we're in, not only because of the pandemic, but also because of an upcoming election next year. So the process is also highly politicized. So perhaps the best way to really overcome these tensions, since we're dealing with a national pandemic, I think the best way of coming up with a solution for COVID responses that are consistent is for local government units to really adopt the suggestions of the national government, especially for contact tracing, because that's really one area which there seems to be a lot of different and disjointed approaches towards how to collect information and how to trace, who else might be infected within different communities. So thank you.
So the next questions will be passed toคุณAbdulsukoดีไหมโอเคคำถามนะครับได้ยินไหมครับคุณอับดุลครับได้ยินไหมครับโอเคครับคำถามก็คือการแบ่งอำนาจหน้าที่ระหว่างรัฐบาลกลางและรัฐบาลท้องถิ่นในการจัดการโควิดเนี่ยควรจะเป็นอย่างไรนะครับใน3จังหวัดชายแดนภาคใต้ขอบคุณครับคุณอับดุลได้ยินไหมครับอับดุลสุโกได้ยินไหมครับคุณอับดุลได้ยินไหมครับคุณอับดุลครับ
ครับได้ยินไหมครับ
ครับคำถามนะครับการแบ่งอำนาจหน้าที่ระหว่างรัฐบาลกลางและรัฐบาลท้องถิ่นการแบ่งอำนาจหน้าที่ระหว่างรัฐบาลกลางและรัฐบาลท้องถิ่นในการจัดการโควิดควรจะเป็นอย่างไรครับขอบคุณครับ
คือรัฐบาลกลางนี่รัฐบาลกลางควรมีแค่นโยบายกว้างๆแล้วก็ให้อำนาจตัดสินใจกับรัฐบาลท้องถิ่นในการที่จะบริหารจัดการเรื่องวัคซีนคนที่จะมาร่วม การวางบริหารหรือแม้แต่การศึกษานะครับเพราะว่าถ้ารัฐบาลท้องถิ่นนี่เขาจะรู้ดีว่าคนในพื้นที่เนี่ยนะครับเป็นใครอย่างไรนะครับง่ายกว่าการจัดการเพราะว่ามันมีปัญหาในเรื่องของความมั่นคงด้วยจังหวัดชายแดนภาคใต้นี่มันไม่เหมือนกับที่อื่นเมื่อมีปัญหาเรื่องความมั่นคงนี่บางทีเนี่ยประชาชนเนี่ยไม่มั่นใจในรัฐบาลกลางแต่ว่าถ้ารัฐบาลท้องถิ่นคือเป็นคนมาลายูเองอบจเป็นคนมาลายูเขาพูดกันง่ายอะไรง่ายแต่ว่าเมื่อกฎระเบียบมันไม่เอื้อเมื่อกฎระเบียบทางด้านกฎหมายเนี่ยมันไม่เอื้อให้รัฐบาลท้องถิ่นเนี่ยตัดสินใจได้ง่ายนี่ปัญหาก็แก้ได้ช้าเมื่อแก้ปัญหาแก้ได้ช้าปัญหาก็ยิ่งเพิ่มปัญหามากขึ้นครับ
ขอบคุณมากนะครับสำหรับ so thank you for the answering the question so last questions is will be the Philippines
มันไม่ใช่เรื่องวัคซีนอย่างเดียวแต่มันเรื่องการศึกษาด้วยการศึกษาต้องฟังกระทรวงสาธารณสุข
Okay, sorry. Maybe the signal is quite delayed. So, so I would like to carry on the next questions. So I will put the questions on the chat as well. So this is really interesting questions about the gaps of the people in the society. So the questions for the Philippines is how are the rich Filipinos getting the vaccines, getting preferential treatments in the Philippines, or are they flying to the US to receive good quality vaccines?
Thank you, Art. Just one moment. Let me just read the question again. How are the rich Filipinos getting their vaccines? Are they getting preferential treatment in the Philippines? Or for the vaccines, at the moment, one of the vaccine procurement program of the Philippine government is that in order for private entities or private institutions to procure vaccines or buy vaccines, they will only be allowed to do so by the Philippine government if they sign a contract or a tripartite agreement wherein for every vaccine, for every dose of vaccine that a private organization will buy for its employees, it will have to donate the same amount of vaccine for the Philippine government. So in a sense, despite the fact that private businesses in the Philippines might be able to procure the vaccine brands of their choice, given that they're forced to make donations of the same amount to the Philippine government, still benefits the Philippine society in general, because once these vaccines are received by the Philippine government, then these vaccines are distributed to different local governments or to different cities and localities to administer these vaccines. So as for individuals, the individuals getting preferential treatment, or at least perhaps not getting imposed the same harsh punishments for quarantine violations, is one issue that was very big here in the Philippines. At the height of the first lockdown last year in around March and April, a Philippine senator who was still waiting for his own test results, swab results, was seen and caught on camera, going shopping and walking around in a hospital waiting for his wife to deliver who was about to, go in labor. So that drew a lot of criticism and talked about the disproportionate nature again in how the implementation of these COVID procedures or these COVID protocols seem to always favor those who socioeconomically might be doing better. So yeah, unfortunately, when it's the poor or the people who come from more marginalized areas, when they're the ones who are committing quarantine violations, government doesn't think twice in punishing them, and also trying to make a show out of it, and in a way to discourage others from doing these. But yeah, as for the preferential treatment, we're not seeing a lot of this, as once the vaccines are being or once the people are being vaccinated or inoculated, normally people don't know what brand of vaccine they'll be receiving unless you are getting your vaccination from your private enterprise that you work for. So yes, that's my response to that question. Thank you. Thank you again for that question.
Salamat po, salamat po. Okay, so last but not least, before I pass to Dr. Robbins, I would like to give a little bit concluding remarks about this session. So as we learn from the specific case from 5 representative countries about the COVID and the implementations of the policies that impact to the life of the peoples in the societies, how does it impact to the peoples? It's very important to understand the case that it was impacts to the life of people. So the government have to improve after they see the problems, have to learn from the lessons that we have been get through from the peoples and also from the scholar, from the honorable guest today. So it's made me remind of the Chinese proverb. It's called 学而不识者忘，识而不学者殆. So this means is learning without thinking is West. Thinking without learning is dangerous. So as you can see this, you have to learn from us before you implement it. You have to concern to the people first before you do some kind of enforcement. So it will release, demise the impact of violations to the freedoms. So now I would like to invite Dr. Robin Ramcharan, an exclusive directors, to give us, to provide us concluding remarks for our conference. Thank you.
Very good. Thank you, Ajahn Art, and thank you to all the speakers for your wonderful presentations. I think we got a very comprehensive view of, a picture of what is happening in the region. And I have a number of observations, remarks, let's say summary points, if I may, that struck me as I listened to you all throughout the afternoon. We have had quite an extensive discussion over the 2 sessions, the 2 panels on, human rights in COVID times. So human rights in the time of COVID, lessons learned from Southeast Asia. So I think one thing which strikes me, even right to the end, I was listening to you, everyone here, and even from the questions, is number one, the need for sharing information. I hear that, I see that saw that in your presentations, I heard that in your voices, and clearly the engagement that you brought to the discussion today exhibited clearly the need for sharing of experiences and best practices, and the need for civil society space to be engaged on this as on many other topics. So continuing from that, I think obviously it's no secret that COVID-19 pandemic is real. Unlike what some politicians tried to tell us at the beginning of this crisis last year in certain parts of the world, right? It is very real. And governments whose sacred duty is to protect us, right? Nationally, internationally, it is their sacred duty. And so, John, if I may borrow from your presentation, I think it was yours, when you talked about an alphabet soup, I think it was, or something to that effect. There has been an alphabet soup of laws, policies, different measures that have been used, right? Some old, some new, and sometimes some contradictory, but all having an impact on our fundamental rights, yeah? Including the new emergency acts and so on that you have spoken about. So COVID-19 is real. How do we deal with it? We need effective government. We need open government, and we need acknowledgement that civil society, in particular, non-governmental sector, has a vital role in playing, even if it means in holding the governments to account when they themselves provide inaccurate information. So that's my first broad point. It is real, and we all have a role to play. The second point is, as was stated right at the beginning in our report of Asia Center and by Dr. Gomez, is that there is obviously a real infodemic, and that infodemic has a massive impact on the right to information. So the key point that I take away and I want to emphasize here is that the right to information, a fundamental right, includes not only that simple right, but included in that is the right to accurate information. Without accurate information, we frankly, on so many fronts, we are lost as society. So I think that is needs to be borne out. And so in our Asia Center report, one of the things that we've been trying to do, and we will continue to do, is to try to map and track this infodemic, this right to, the impact on right to information, and the lack of accurate information. Where does that information come from today? The majority of people in the world today don't get it from the printed press. Yes, it's still there, but even the printed press has taken their operations online. As we all know, it's a truism by now that most of our information is coming from online sources, social media, and so on. And so is the internet important? Is social media important to the accurate information? Absolutely. And is accurate information vital to something like our health? It goes without saying that it is, right? It's vital to our human security, which includes our health. How can we make informed decisions if we don't have accurate information? How will we know where is the nearest clinic with a good doctor to treat our child, our wives, our husbands? How will we know that if we don't have accurate information? How will we know how to care for ourselves if we have all kinds of false information? And Dr. Gomez in our report noted a number of kinds of mis or malinformation, the different forms of the infodemic. Conspiracies on the origins. Well, we need to know that to prevent it in the future. If we have conspiracies, then we have a problem, too many conspiracies. I will note the impact of the conspiracies, not coming from this part of the world, but the impact of these dangerous conspiracies of all kinds. A father in the US just shot his 2 children because he believed in a conspiracy theory. That's the kind of madness that we are facing, right? You have the problem of infodemic involving misinformation involving infections and deaths. You have the problem of rogue remedies. I will not even have to mention who told us that bleach might be an answer, all right? And then finally, you have vaccine efficacy. We have unprecedentedly produced vaccines at a record pace. They are all effective, nearly as effective as each other. Some have some question marks, right? But they are effective, but yet we still have some doubts. And that is unhealthy, to put it at the least. So we need to fight this infodemic in all its forms, these 4 forms. So that's my second broad point. We need accurate information to fight these infodemics, and the internet space is where we will get that information, and to track that internet space and how we can improve it, maintain our right to access to information. We have been using a toolkit, a toolbox that is ready-made inside of the SDGs indicators. The third point I would like that came out of all of your discussions and our report and so on, and the questions, is the political management of COVID-19, the political management of COVID-19. Yes, governments all over the world, including here in Southeast Asia, are trying to manage through health provisos and laws and emergency decrees, and they are trying. But at the same time that they're doing that, we cannot ignore the fact, especially in this region, but not only, but certainly in this region, the political management of COVID-19, the protection of the images of governments, unfortunately, has been part and parcel of the style and approach to management of COVID-19. Yeah, so we must call this out. This over concern with protection of image, right? Infodemic politics, if I can put it that way. It was alluded to in one of the presentations, I think from our friend, our colleague in Ubon, that the elites, the pro-regime elites in certain parts of the world are part of the problem, meaning part of the infodemic problem. And they have a role to play in fighting, calling out the infodemic as well. Our colleague also mentioned that, going back to what I said earlier, there is government, we need responsible government. And now I think in alluding to section 157 of the Thai Criminal Code, our colleague is calling for responsible government. And when government cannot fulfill that role fully and adequately and properly, then we have to ask questions at minimum, right? And our colleague John Binondo from the Philippines noted the militarization of the answers. That surely cannot be the way forward in addressing either the pandemic or the infodemic, right? And by the way, I would note, in terms of the political management of COVID-19, it's interesting, Benjamin Lowe, that Ismail Sabri Yaakob has just been appointed, named the new prime minister. So let's look out. I'm sure you will be looking out for how he will manage this crisis. We're all looking and watching, right? What will happen. A fourth thing is that was noted across all of the presentations and in our report is the problem of censorship and self-censorship, right? We need for checks and balances upon this, on governmental instances, but we also ourselves should not be constrained in calling out the difficulties in managing the crises that are faced. And I like to believe, and I do believe that that is partly what we are doing today through this conference, this webinar. It's an important part of maintaining the pressure on calling out and calling for better solutions. We need accurate information, and that is the problem that we are addressing here today. We need accurate information for health, and it cannot, our health will not win over unless we have that kind of accurate information. Fifthly, and I just have a few more points. Fifthly, the point about access to information, accurate information, in relation to marginalized communities, I'll come back to that, and in particular, inequalities in society. And our colleague from Ubon mentioned structural inequality, and several of you mentioned also the issue of inequality. And on that note, relating it to access to information, it is interesting that here in Thailand alone, if you look at the number of subscriptions to internet or mobile accounts, they have gone down quite significantly because people just can't afford it. And that's not a question of rural and urban. The inequality is right there in the middle of Bangkok, right? People who cannot afford a subscription in these pandemic times. So how will they get access to vital information? The affordability issue is also related to this infodemic. And again, the SDG indicators help us to monitor those aspects. Sixthly, this was mentioned through several of the presentation, the impact on media and NGOs, right? Civil society, as we said before, has an important role to play in managing these crises. Transparency, the access to information that they have, that they can share and provide, is vital to the management. Civil society should not be seen as an obstacle or an impediment to management of the crisis. And they have information that they have also from the ground. So when they call out information mismanagement of all types, that is to our benefit. So I would like to note it is a very valid point, and often they can help us to prevent the perpetuation of this crisis by providing the necessary information. Seventh, marginalized communities, including women and children, were mentioned. And I would like to add here the problem of migrant workers, right? In particular, who have been blamed, and a lot of hate speech has been directed at, of all kinds, at migrant workers in various settings across the region. And our colleague from the south of Thailand also, as well as I think some other colleagues have mentioned the issue of marginalized communities in the South. And in that regard, what is coming out was the need to work with local community organizations. And secondly, the need to work with local governments. Even here in Thai regulations, I understand that emergency health decrees and laws provide for local authorities to help with the management of this crisis, and that it should not be merely a centralized and certainly not a PR exercise at the central government level. So the community organizations, religious, women's organizations, and so on should all be involved. Lastly, or second lastly, I want to say that at a broader level, and just a couple of very quick points, is that the net effect, one of the net effects, other than the health effect, is to increase the effect of the infodemic, is to increase the anxiety that there is already in societies across the world over so many issues. There is so much polarization. And unfortunately, the infodemic has allowed for the politicization, the ideologization of simple scientific information as to when you should take the vaccine, who should take the vaccine, and so on. Society is already fragmented and politicized. And so the COVID-19 has spectacularly exacerbated and spectacularly demonstrated this politicization, and has increased the angst in society. And we come back to the need for accurate information and scientifically accurate information to be propagated from all kinds of credible sources and independent sources. And finally, building again, I think, John, it was you who mentioned, this is very important to my mind. Sorry, my notes are escaping me. We must emphasize that, John, as you said in your presentation, you mentioned the need for reinforcing the rule of law, yeah, and so many levels, including in addressing this pandemic. The free flow of information and accurate information is vital to addressing this point. From free flow of information, accurate information from all sources. And here again, I come back to the utility of the monitoring toolbox that we have from the SDG indicators. So with that said, let me conclude and thank all of our presenters, certainly our panelists and partners and supporters for their excellent support, presentations, and collaboration. And with that said, I turn it back to my colleagues at Asia Center for their final concluding remarks. Thank you very much.
Thank you, Robin. Our remarks from the Asia Center team here in Bangkok is really to remind everybody that we have 2 surveys ongoing. Survey 1 for session 1. We would appreciate if you could kindly, take a few moments to fill it. It's now here, the QR code. We appreciate that very much. And also, we want to also remind you, you can check in your chat box the link both to survey 1 for panel 1 and survey 2 for the panel discussion. I will end by drawing your attention to upcoming reports and events. First, a joint report together with Harm Reduction International and Asia Center, which touches specifically on the securitization of COVID-19 health protocols. That will be released Bangkok time, coordinated with London at Bangkok time 3 p.m. And the links are available. If there are interest from the media or any advance information, we can make that available. A press release is also available 1 day before. And next would be an actual online event to launch Asia Center's report on internet freedoms in Cambodia, a very rare offering on Cambodia, together with a panel discussion with civil society participants from Cambodia, as well as the special reporter on Cambodia. So we look forward for you to, either access the report, the joint report by HRI and Asia Center, as well as the Internet Freedoms in Cambodia report a week after on 1st September. It's a live event, 10 a.m. Bangkok time for about an hour and a half.